Tuttle and 70? Tuttle and 70? Or Whitfield?
University and Talbast off of Tuttle.
Oh,
Down there.
that's,
All right, you guys ready?
what is that, the budget? Yeah. Yeah, that's 6.
Good morning. Welcome to our regular meeting of September 22nd, 2015. We're going to start out with the invocation by Pastor Wendy Thompson of the Glory Cloud Ministries, followed by the Pledge of Allegiance.
Father, we just thank you for this time in this presence of yours, Lord God, to be in this place, to give us great peace and great understanding of what's going on in our county, Lord God, that you will guide us and direct us in your ways. Lord, you said in your word, to seek ye first the kingdom of God and his righteousness, and all these other things will be added unto us. We thank you, Lord, for your direction. We thank you, Lord, for your love in all in this place and all these people, Lord God. We thank you, Lord, for your joy. That's our strength. And Lord, we thank you for the divine protection that you give us, Lord, in this county. We thank you, Lord, that your words and your power will stop the epidemic that's taking place in Manatee County. And we thank you, Lord, for your presence in this room. We thank you, Lord, for giving us all the solutions to the problems that we're having, Father. And we give you all the glory and all the honor and all the praise at all times. In Jesus' name.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mr. County Administrator, do we have any changes to the agenda today?
Morning, Madam Chair, members of the board. We have several recommended changes. First, changes to the consent agenda. Under Human Resources, number 25, the 2016 medical and dental premium rates, active employees and retirees. Exhibit B was replaced to correct a generic prescription benefit for non-preferred pharmacies to read 20% coinsurance or $15 minimum. Changes to advisory board and committee appointments. Under the county administrator, number 45, adoption of resolution R-15-165, Animal Service Advisory Board, and item number 46, Animal Service Advisory Board appointments. We recommend deferring both of those items. Additions to the consent agenda. Under Community Services, item number 55, amendment to agreement with Manatee Memorial Hospital. Request to authorize the board chair to sign an amendment in ratification of the agreement between Manatee County and Manatee Memorial Hospital for the provision of indigent health care, correcting a Scrivener's error in the legal name of the hospital. Those are the recommended changes, Madam Chair.
Okay, thank you. We've got at least one item on for time certain, and then we have a 3 o'clock meeting that we will break for if we're still in session. 10 o'clock, we have item number 54. So we're going to go ahead at this time, go right into our awards, presentations, and proclamations. First up, we have an award for the Employee of the Month, Terry Simon.
Good morning, Commissioners. The reason for all the moving around of furniture is this is Daniel Bradley. He's with our library system, and he's going to be signing for Terry. Our Employee of the Month, Terry Simon, is deaf, and so when we bring her to meetings and events, Daniel, out of our own staff, spends most of the time working for Terry. So I'm going to have Terry come up. I want everybody to know. This is Terry Simon. She's your Manatee County Government Employee of the Month for September, and it's quite an honor for me because this is our second Employee of the Month. If you recall, we had the August employee, Dennis Houston, and this is Terry Simon. Terry works at our South Manatee Library, but for over 28 years, she worked at our Central Library. You also might notice that Terry has a friend with her, Mr. And this is a very unique experience for the county because Terry has a hearing ear dog who is certified, and that's Mr. She'll probably tell you more about him when she speaks. But this is a pilot program that we began in May with the assistance of our Human Resources Department and County Attorney's Department. When Terry came to us in January and sought the ability to have more independence in her life, to be able to move out on her own, to be able to do even more than what she already does at the library, she asked if we would consider allowing Mr. to accompany her each day. And so he went through a rigorous training program, and then Terry worked with him for a number of weeks. He became certified, and he's been with her since early June. And we're very proud of that program. We're very proud of Terry, and you can know that Mr. helps her with sounds, things that we take for granted, sounds from the computer that close out records so that you know that a patron's record is closed and there are no fines. When folks come to the library and you might be calling Terry's name and they're behind her, people think she's not responding or she might be rude, but she can't hear them. And so Mr. knows to alert her by touching her leg and telling her that someone is calling her name. And she, even without Mr., is an absolute dear asset to Manatee County. And so I found out a few things about Terry that I wanted to mention, but before I do, I just want to let Terry know that her fellow employees, her fellow colleagues nominated her for this award, and I want to read just a couple of those. So Terry, these are about you. This is from Kevin Beach, the library operations supervisor, and he wrote to the committee, due to Terry's physical challenges, she works very, very hard to communicate and focus on the needs of patrons, yet always goes that extra mile with each one. She's extremely dedicated to a high level of customer service. She's always bright and cheery. She is. She's extremely dedicated, and due to her years with the county, she's very knowledgeable about the library and all the services. She's also has a big heart and will help anyone. She never uses her challenges as an excuse to do less. She's a great role model for the patrons and for the staff, and especially she's a role model for those others with disabilities in proving that she can function and lead a very productive life. One other one, Terry, I wanted you to know was from Erica Dow, the librarian 3 with Information Services, and she wrote, Terry Simon's a great customer service agent for the library, undeterred by complete hearing loss. She consistently communicates with library patrons in a bright and friendly manner. She has numerous compliments of her kind service from the patrons. She treats her coworkers with deep caring and respect. And for that, and many other reasons, you've been nominated, and you are the September Library or Employee of the Month for the county. Before I turn it over to Ava, I wanted to mention that Terry was born in Bedford, Indiana, so she's a fellow Hoosier. That's probably why I like Terry so much. But Terry was adopted at 3 days old. She lived over 18 places before she reached the age of 4, and at 3, it was discovered in her first hearing test that she was the 30% hearing loss in both of her ears. No hearing aids were given at that time, and Terry's hearing dropped to below 50% by age 12. So she was finally fitted with hearing aids, and Terry was declared profoundly deaf at age 36. But Terry went to Bayshore Elementary, and she now works right across the street at the South Manatee Library, which I think she's thrilled about. Loved it at the Central Library and was a great asset there, but it's closer to her home, and she can get there easier as well now with Mr.'s help. She's a graduate of Manatee High, and one of the things she likes best about working with Manatee County is the number of people that she knows. So Terry, I want to turn it over to Ava, and all of your fellow co-workers are behind you and in the audience.
Good morning. Good morning, Commissioners and County Administrator and County Attorney. Terry is one of our shining heroes. She demonstrates everything wonderful about this county and this staff. She is caring and she is gracious and she goes the extra mile with every interaction. There are no limits for Terry. I don't think she's ever considered anything a limit. In fact, a quick story about Terry, who is also a vet, is her work in the military. Terry went to see if she couldn't sign up and figured out how to watch those hands move the dials and know when there was a sound. Memorized the eye chart so she could get into the service. This is a dedicated and stubborn gal who's not going to let anything get in her way. And this has proven true again and again. She spent 4 years in the military, and most of them here in Florida, but part of the time in Texas. As she said, she's also a graduate of Manatee High, but she worked on military library bases, and she also worked in her high school library. And so for the 29 years for the Manatee County Library, she's also had years beyond that. This is something that she cares about deeply. She loves to connect people with books, and she loves to connect with people. There was no reason Terry had to work on a front desk. We had a lot of other work she could have done, but she chose to do that because she's a very social, a very caring, and a very customer-oriented staff member. She just cares about what she does all the time. She made a great connection with Danny when he came, and that has been a big help for her as well. But it's also helped the community to see what she can do. She has had complaints in the past. People said she didn't pay any attention to me, not realizing that when they were behind her, she didn't know that they were there. So now it's a lot more obvious. Mr. is on a leash on her belt at all times, and he helps her to navigate, and he helps her to do her work by hearing the sounds she cannot hear. She told a story of once leaving the house with the water running and never being aware of it and coming home. You can all imagine the water bill that day. Just like Terry, Mr. is adopted. He's a rescue dog. And she has spent months working with him, and she's done a magnificent job. He aids her in what she does. We're really grateful for all of you making this possible, for her to have this relationship, and we're grateful to have Terry on our team. She makes us proud daily. She is gracious, she is patient, and she is a customer service extraordinaire goddess. We love her. We're so glad she's part of our team.
Wow.
I'm so humbled and so grateful for all the people that saw my abilities. I don't understand all the sweet comments about customer service. It's not that hard. I just learned from a very young age that you want to treat people the way you want to be treated. It's not hard to say good morning, good afternoon, good evening. Enjoy your books. Have a nice day. What's hard is to recognize that when you do that kind of thing, you may never get the glory. Okay? Today, I got the glory. Does it feel good? Maybe. But I've always said that I appreciate Manatee County government because 28 years ago, when I was not deaf, I was just hearing impaired at that time, a single mom of 3 applied for a job, needing it desperately. Someone, somewhere, saw an ability. Like I said, it's a very humbling experience. I'm so very grateful to all of my co-workers. I love them all. Every last one of them. There's not a single person I don't love. I may not like your work habit. I do love you.
Amen.
And I want to say thank you. And I love you. To all of you. Thank you.
Thank you. Wow.
Congratulations.
Thank you all for coming forward.
Won't hear you.
I know. I want to say thank you very much for coming forward, for the work that you have done for this county for the last 28 years. That's a wonderful run, and thank you for being a shining example for others in the community. Thank you.
Thank you.
You.
Thank you, Danny.
Thank you.
All right. Next, we have
Little Mr.
Paul, I'm going to probably say this wrong, Paul Villaluz, recognition of the recipient of the Institute of Transportation Engineers 2015 Coordinating Council Best Project Award.
Good morning. Good morning, Sajid Kamia with Public Works. This morning we're here to recognize Paul Villaluz and a great achievement that he's done through the Institute of Transportation Engineers. He is a great employee and a great staff member, and he does a lot of good stuff for the community and for us and for you all. But that's actually not why we're here this morning. We're here because he's also a great person and a great professional, and he applies that outside of after hours to give back to the profession. And so without further ado, I just want to kind of read the award and what he received and how he got it. Each year, the Institute of Transportation Engineers sponsors an awards program to honor outstanding achievement in transportation engineering and distinguished service to ITE. The awards bestow international recognition upon their recipients and increase the public's awareness of the role and responsibilities of the transportation professional. The Coordinating Council Best Project Award recognizes the best technical product resulting from work developed, combined, and sponsored by one of 9 different councils in the previous calendar year. This year's 2015 award is presented to Paul Villaluz in recognition of the Outstanding Traffic Engineering Council project titled Sight Triangle and Corner Clearance Policies at Intersection and Driveways, an IT informational report. And so with that, I'd like to say congratulations to Paul, and I'm sure some others would like to speak as well.
Morning, Commissioners. It's a great honor to be working with Paul. We got him about, I would say, 3 years back now. In fact, a little over 3 years back from Vegas. And this was the project that he started working while he was in Vegas. So no, whatever happens in Vegas does not stay in Vegas. It comes over. And we are very proud to have him on our team. And this is a nationally recognized project report that he worked on. I would be remiss if I don't say Sanji's name on this. Saji and Paul knew each other. It's a funny story. They were working together on this project. So this is, while Paul was the chair of the committee, but Saji has also given his great input on this. So to me, it belongs to both of us. And for me, it's an honor to be part of such a great public works team that we have 2 nationally recognized engineers working on our team. So this for me is for both of them. So again, congratulations, Paul, and congratulations, Saji.
I'd like to thank the county commissioners for recognizing this honor. It was a great surprise when I heard about it in August. I thought it was a prank. When I went to Hollywood and received the award, I knew it wasn't a prank, and it was a great, pleasant surprise. It isn't possible without the support of the Board of County Commissioners and the support of Mr. Schulhofer for the Public Works Department of Saji and Vishal and our wonderful team, both in traffic engineering, planning, and traffic operations. It's definitely not possible without my wife, who's standing right behind me. I can't tell on the, it's the left-hand side. There are many times when I was anxious about how the paper would turn out. There were things that we sacrificed in order to make it possible, and I'm really thankful to her. Without her, this isn't possible at all. I guess before I break up, I also would like to thank the ITE, John Davis with the Traffic Engineering Council, Courtney Day with the technical committee and staffing, and Saji. I'd like to honor Saji with this plaque that came in from ITE. This is a total surprise. I don't think he's known about it. ITE wishes to recognize Saji's contributions to this paper as well.
Wow.
And thank you, Saji.
Great. Thank you.
But thank you very much. I appreciate the time, and thanks again for your support.
Thank you.
Thank you.
Thank you.
Congratulations.
Thank you, and thank you for recognizing that it's all about the team, and that's an important thing to protect is our visibility. I know visibility triangles and sight distances are very important, and I know it's one of those engineering things that people might not understand, but it helps to keep our folks safe when they're traveling around the county. So thank you very much for your work.
Thank you.
Okay, next up, we're going to have proclamations. Can I have a motion for approval of the proclamations? So moved.
Second.
Okay, we've got a motion and a second. All those in favor signify by saying aye.
Aye.
All those opposed, nay. Chair votes aye. Motion passes. We have two proclamations, but only one of them is going to be presented today. The only one that's going to be presented is the Florida Manufacturing Day. Someone's here to please come forward. Manufacturing Day. All right. Whereas recognizing October 2nd, 2015, as Florida Manufacturing Day is an effective way to highlight the importance of manufacturing in our nation's economy and to draw attention to the many rewarding, high-skilled manufacturing jobs, as well as supporting and celebrating Florida's manufacturers and school programs that prepare our future workforce. So true. And whereas the Sarasota/Manatee Area Manufacturers Association, Career Edge, APICS, Florida Advanced Technological Education Center of Excellence, that's a mouthful, National Tooling and Machining Association, Society of Manufacturing Engineers, State College of Florida, and the Manatee Technical College support manufacturing and manufacturing careers. And whereas coordination for Manufacturing Day student tours is led by the Sarasota/Manatee Area Manufacturers Association in conjunction with the Florida Advanced Technological Education Center of Excellence and the Manatee School District to strengthen technical and academic skills of young adults enrolled in manufacturing, engineering, and design courses of study. And whereas manufacturing is a cornerstone of our economy in Florida and the United States of America. And whereas the nearly 600 manufacturing facilities in our area produce a diverse array of products and provide employment for approximately 10,000 citizens. And whereas the Board of County Commissioners commends and supports this important cause and the organizations involved. Now therefore be it proclaimed by the Board of County Commissioners of Manatee County, Florida, that October 2nd, 2015 shall be known, designated, and set aside as Florida Manufacturing Day in Manatee County, Florida, and we urge all citizens to join in recognizing the value of our manufacturers and the importance they serve in our county, state, and nation, adopted with a quorum present and voting this 22nd day of September, 2015, and signed by Betsy Benek, Chair. So
Thank you very much. Good morning. I'm Peter Straw. I'm the Executive Director of the Sarasota Manatee So I promise next year we'll just use our acronym. We'll be SAMA, because that's how y'all know us. And we do represent 600 manufacturing entities and likely related businesses in our two-county area who understand the value of creating a workforce for the future. And I want to thank this commission and the Manatee School District for their support of technical education. Last year, Florida led the nation in the number of students on tours inside high-tech manufacturing facilities across the country on our Made in Florida tours. This year, on Manufacturing Day, we will have upwards of 800 students touring facilities such as Pierce Manufacturing, V3 Electronics, Sun Hydraulics, Dentsply, Teak Decking in Manatee County, as well as other facilities in Sarasota County. And it's our hope that when those students see inside and see the careers that high-tech manufacturing has available, there'll be that aha moment where at least some of them will say, wow, that's a career I could have without leaving my home county. Mm-hmm. That's a career that will support a family and support this community. So we appreciate your support of that and your continued support of manufacturing as an integral part of a diverse and healthy economy. And is Larry on the conference call?
Yes.
Larry, you here? Can you hear him? He keeps his phone on.
I just wanted to say thank you to Commissioner Bussell because he's been one of our stalwarts for years in supporting manufacturing.
Yes, I am.
And a speedy recovery to you, sir.
Right, there's a delay.
Oh,
He's watching on TV as well.
I tend to do that.
No, I do that. Yeah, we're getting a bit of feedback from the TV, Larry,
Sorry.
so.
Okay.
Okay.
Well, so thank you all for that. And know that you are all invited, by the way. Last year, some of you were able to schedule. October 2nd is a Friday. I would invite all of you to attend one of the manufacturing tours in our area. To do that, simply reach out to me through our website, and I'll let you know the closest tours to where you are. It's quite an experience, isn't it? Mm-hmm. Thank you very much.
Thank
Mrs.
you.
Shaw?
I think we have a couple folks.
I wanted to thank you for all you do in the community, and I think most of those businesses you mentioned were in South County, and South County is really booming and rocking it right now with manufacturing. I did attend the event last year at Sun Hydraulics, and I was on tour, and you had arranged that. So this year I'll pick another company, and it was great to see all the youngsters there and just to see their engagement and opening up doors for them to show them different skills and different opportunities. And it's just not all about people think, you're on a production line. It's not. You see all the engineers and technicians and computer gurus.
That's a great observation.
Yes.
Modern manufacturing is not the mental image that too many people have from the Industrial Revolution. It's all about team building, critical thinking, the ability to communicate with their coworkers, and to see what needs to be done and to implement rather than waiting for someone to come and issue instructions. That's why American manufacturing still leads the world in production. We hear every day about China this and China that. The truth is, American manufacturing, 19% of world's production. China's 13%, and they're hungry, and they don't have to live into the regulations and the environmental restrictions and the taking care of the employees as we do here. But even with all that, American manufacturers still lead the way. And the only way we can continue to do that is to be innovative and to build a workforce for the future. So I appreciate your being there.
Thank you.
And I also wanted to say thank you because I had heard a great presentation that's going on in Pasco County where they've put together a program for internships, apprenticeships. It's something that I want to be talking to you about. It's a very exciting opportunity for kids to start out when they're 16 years old and team up with an advanced manufacturer. And it's modeled on a program out of Germany, and it just sounds
Familiar with
like
that program. In fact, as I was in one of the preliminary meetings on that.
Yes.
That's exciting. We're doing that already in Sarasota County.
Okay.
And we just rolled out the initial conversation about summer internships for teachers inside manufacturing facilities. And that's a big commitment on the part of the teacher for the summer, but we're also looking at maybe a job shadowing day, spend one day inside a manufacturing facility as a teacher who then could go back and influence countless young people about the possibilities of careers. We also have internships for students. We have an apprenticeship program, which is, we're going full circle. We now have apprenticeship programs for trades such as precision machining, welding, those sorts of things. And every one of those apprenticeships leads to full-time career employment, which is the key. So
Great
I appreciate you
opportunity.
bringing that to light. And we will be looking to work with Doug Wagner and the other people in the career and technical education field of Manatee County so that next summer we can have more of those opportunities available in both counties.
Okay, thank you. We appreciate
you.
you being here and bringing this forward. Okay, is there anything else to? Nothing? Okay. Those were the only proclamations that I had at this time. We're going to go ahead and move to our consent agenda. Are there any items that any commissioner would like to pull from the consent agenda? Commissioner Baugh?
Madam Chair, I don't necessarily want to pull the items, but I just wanted to say on items number 9, 10, and 11, travel authorization, when I was looking at those, I just wanted to mention, because I never realized it was this way, the county attorney and the county administrator have two different ways of getting authorization for travel, which I thought was interesting, and I kind of wanted to see them both have the same criteria. The county administrator can get his approved by the chair of the board, where the county attorney has to get authorization from the Board of County Commissioners. I just wanted to point that out because it was something I never realized before, and I know that it's done every year. Angel. So I just wanted to mention that. And also, the B-3 new per diem and travel reimbursement rates, I think it came out July 1st, 2015. And I just wanted to mention those things because it was things I didn't realize. I just want to make sure all the commissioners were aware.
Commissioner Chappie?
Yes, I just wanted to point out agenda item number 27, which is a resolution R-15-164. It's in recognition of Chuck Klaskowski, who is our executive director of West Coast Inland Navigation District, and he's been that since 1994. He's done an amazing job in working with not just one county, but 4 counties. So it's a tougher, might be a tougher, in some respects, tougher dealing with all the elected officials that are in the different counties. And again, he's done an amazing job in leading West Coast Inland Navigation District. So thank you, Chuck, and we will miss you.
Okay, thank you.
And Justin McBride is going to be the replacement, and sometime right after the first of the year, he'll probably be coming down here to do a maybe 15-minute presentation at one of our meetings, so you can be introduced to Justin and to West Coast Inland Navigation District again.
Yeah, I think that's a good idea because when we have these regional organizations that are kind of remote, sometimes we don't know exactly how things are done, and so that would be great for him to come do a presentation, introduce himself. Commissioner DiSabatino?
Yes, item number 25, it's the medical and dental premium rates, active employees and retirees. I think, this warrants some discussion and just some mention from staff because they really worked hard in trying, so I think it shouldn't go unnoticed and it shouldn't get buried in here, so I think we should bring that back for 11:30.
Or a regular at the end of the meeting, yeah, because it may even take longer.
Or after.
Our agenda?
Yeah. Okay. And then when we always have those collection items that always cause us agita. I just wanted to find out, when's the last time we went out for bids for our collections agency? And maybe we need to explore that because I've heard about another collection agency that might be a little more aggressive. So that's something that we can discuss in the future.
You're talking about for pursuing bad debt, is what you're talking about,
Correct.
collection. I just wanted to clarify it. Some people
Right.
might not have understood that.
And that's it. Thank you.
Okay, so we're going to poll the number 25. Is
I
that?
pushed my button.
I'm not done yet.
Oh.
I'm just want
I
to
wanted
make sure
to make-
that that's what we agreed that she's going to poll. We're going to poll 25 to be heard after the consent agenda when we go to the regular agenda. We don't know exactly what time.
And that'll be-
Typically, it goes at 11:30, and so I would like to say that we're going to bring that up at 11:30, so to give staff time to be able to come back if they'd like. All right, next up, Commissioner Whitmore.
The collections that Commissioner DiSabatino mentioned, the collection, even though, and this has been explained to us many times, and you know me, I've always had issues with how much we write off, but it just gets off our books, and then the collection company still goes after them. And I think we went out for bid, and I think Ed should have somebody send him a message, I think within the last couple of years, maybe 3 or 4 years ago. So, but it's not like they stop. they just
Oh, I
get
know.
off our books, and then these people continue working on them, and they get some, and then sometimes they don't. Commissioner Baugh did bring up a good point. Can we just pull item number 11 and bring it up at a future, because our attorneys report to us as the county administrator, so I don't understand why the travel authorization is any different. I don't think anybody's ever had a problem with it, but for it to be consistent and everything nice and clean, why don't we just pull item number 11 for a future meeting, if that's all right with the board? That's a good point.
Just can't go anywhere until we
No,
decide.
we won't. We'll let you go somewhere now, but bring it back in the future.
Madam Chair, might I suggest that the item simply be approved
Approved.
today, and we can come back to the board with a
Yeah.
report?
Okay.
Right.
It's a
It's a minor
simple,
thing.
it's a very
Minor.
minor thing.
So we could just make the changes at another meeting.
You know, each of us has contracts with this board that authorize us to travel. So
Right.
I'm not even certain that this thing is necessary from year to year.
And that's what I think we should discuss.
But it's something that's been historically done
Yeah.
every year in September for the upcoming fiscal year.
They do it at the port, too.
You know,
Yeah.
So rather than put Mr. Hunziker at risk for not being able to travel in the month of October,
Or you.
Plan to go anywhere?
in the absence of board approval, I would suggest that the board simply approve these items today, and we'll come back to you with a more detailed report.
Is that okay to them?
Yeah.
Madam Chair, I never meant to, like I said, it wasn't to pull or change anything. I just wanted to make sure that the commissioners were aware, because I had never
I
realized it
wasn't
before.
either.
Assumed it
No,
was the
I
same.
wasn't aware either.
Yeah,
I don't-
that was it.
Okay, so if everybody's agreeable, we'll keep that on the consent agenda for now. Take a look at it, because I don't know which should be changed to what, quite frankly, since they're different, is what you're noting. And whether or not they should be different or should be the same, we can have a discussion about that.
Good.
All right, next up, Commissioner Smith.
No, I just was echoing what Commissioner Bob brought up. I think it's excellent. What she brought up is really excellent. I wasn't aware of that myself, and I think it should be consistent. And I really hope the county attorney look at all of that. You know, I don't think we up to date on any travel.
yeah.
It's historic and outdated, to be honest with you. Even per diem, what Commissioner Bob is mentioning. Thank you.
Okay, next up, Commissioner DeSabatino.
Right. I appreciate Commissioner Ball bringing it up, but to me, it didn't raise any red flags because they have different types of contracts anyway.
Right.
And Mr. Hunsinger has a term contract, and Mr. Palmer is at will kind of contract, so.
Okay.
Well, both of us serve at will.
Yeah, sure do.
It's just that Mr. Hunziker's contract has a time term
Right.
embedded within the contract. Mine does not. But each of us serve at all times at the pleasure, at the will of this board.
Got it.
Thank you. Okay, I don't have anyone else on the board. At this time, I'm going to go ahead and open up the consent agenda. Is there anyone in the public that would like to address any of the items that are on the consent agenda? The only one that we have pulled off at this time is item number 25. Is there anyone that would like to come forward and address any of the items on the consent agenda? If so, please state your name for the record and which item you are addressing.
Linda Neely, taxpayer of Manatee County. I have several. Item number 31, which is write-off of uncollectible ambulance fees. As we could probably all presume, those fees are from the indigent. And we're right back to the healthcare issue for Manatee County. There was a lawsuit brought by Doctors Hospital and Venice Hospital against Sarasota County for $400 million that the judge actually states in his opinion that was confirmed, it's not gone, that was at an appellate level, that it was not the citizen's obligation to pay a private institution for their losses, for their obligated duties under federal law. Our esteemed attorney here said that that ruling has nothing to do with health care in Manatee County. The law says that you must provide for public safety. And I've come to this podium many times, and public safety, as a general rule, is slightly illusional. You know, so we're going to write off more bad debt that somebody does have to pay. We paid for the equipment, we paid for the fuel, we paid for the employees' wages, their benefits to be on the job and go out and take people from their homes or location of accidents, and we pay that. Manatee County, which is funded by the people of Manatee County, pay it. So then they try to collect the bill, and it's uncollectible because there's no venue to take something from somebody that has nothing, correct? So once again, we donate money to the indigent, and I believe that I support that. But we, the public, should know what it actually costs us to do that as part of the health care package. When you have that discussion, we should also have that. And then we can talk about 41, utilities. Consideration of rates, fees, and charges for solid waste and disposal services. Just recently, this board approved a contract without putting out for bid for waste removal services. And it was a sweetheart of a deal because nothing was going to change. That was the promise from this side. That was the advisement, I guess, you received from your administration and our staffing. Now, I saw in the newspaper where they are going to raise rates. That was not part of the promise. I understand I have 3 minutes per item.
3 minutes per item. Probably
Okay.
it's hard to hear sometimes, but when she switches,
You
just
switch to
restart the
another one
clock.
and say-
Yeah, it's sometimes hard to hear.
All right, thank you. So now we're right back to an increase. You know, on Tuesday, it was put out in the news that Manatee County's mean income dropped to $47,300. You know, that's the working stiffs in this county that drops that rate. While government salaries continue to rise with the statement that we have to do it because we have to keep the people we've trained. We need those people. This item right here is a reflection of their capacity because it's not staying the same as it was promised. We didn't put it out for bid. We took the existing contract and rolled it over. And was that actually in the good process for the citizens of Manatee County? I don't think so. And Medicare is telling the seniors of this county that come January the 2nd, they're going to have a 58% increase in their Part B, which is their medical care. Are we going to help them? No, we're just going to help the indigents. So we have, you know, America was based on equality, equal for everyone. And, you know, it used to be people had skin in the game and they really did make an attempt, but it's a lot easier to go to Social Security and sign up for welfare for every beneficial service and get a free phone while they're at it. So your job from that dais is to give equal service to us all, and it is hard, I understand that. But when you make the decisions you make, they have long-term effects. And there's only, as I was so appropriately told by an accounting employee last week, there's only so much money in the pot. So we can't do the maintenance on the roadways because there is only so much money to spread around. Well, the news folks is from this side of the fence, all these people only have so much money to spread around as well. And this consent agenda is about spending our money. Every piece of it is about spending our money. And then as far as travel goes, you know, you're going to approve something that we can come back. I did change subjects.
Thank you.
That we're going to come back to that. I think you should have had a workshop on this. I don't think that you should just take this contract from two vested individuals that's in their interest. You know, they're doing research at the molecular level via the internet with countries across the entire globe, and that is about saving human lives and making less human suffering. And they do it successfully every day. Yet our lawyer and our county administrator actually need to be physically present to get ideas to benefit the people of Manatee County. Government can't reach into the new technological age and do this by video conferencing. When people that are talking about dealing with a molecule do that work over the internet. I'm just kind of stunned that, I know there's a room that goes with it and the meals that go with it. And, as a taxpayer, I'd like to know, do we pay their bar bill? I think that's a fair question. If they have one. I don't know if they do or not. And it's that, well, I know the Port Manatee, there's liquor that flows through the convention center, and what kind of inventory control is on that item? It's paid for by the people who rent the venue, I understand that, but what kind of controls do we actually have? So I think that looking at how we spend our money when there's only so much money in the pot on every level is important. And giving a blank check, taking out all the old rules and not having any rules, I don't think that's appropriate either. And then lastly, is this an appropriate time to talk about the hearing tonight?
The budget hearing?
No, if you would come back for the budget
Okay.
hearing, that would be.
No, I'm talking about, the trim notice says that the public shall ask their questions at that public hearing and get answers. If I come to the hearing tonight and I ask my question, will you be able to answer those questions before you take your vote to approve the budget? There's the question.
Madam Chair, we can't predict
Thank
what
you.
kind of questions will be asked at the public hearing
Thank you for
tonight.
giving us that notice. We'll take that, you put us on notice that you're going to ask the question. That's
Well, you
about all
send the
can do.
questions so they can be prepared to answer them. It would be help probably, like
Thank
we've
you.
asked. many citizens.
That's exactly why I also was asking if this was the time. I'll wait till the next citizen's comment.
Yes.
And I'll ask my questions.
Great.
Thank you.
That would be the right time. Thank you. Anyone else who'd like to address the board on the consent agenda items only? Now's your opportunity.
Madam Chair, just to set the record straight, this board recently extended the solid waste franchise agreements pursuant to a contract clause that specifically authorized you to do
We
so.
know.
The
Newspaper.
contracts were originally awarded pursuant to a very competitive process. Moreover, our consultant has repeatedly confirmed for this board that we have some of the most favorable solid waste collection rates in the state of Florida.
Madam Chair.
Thank you.
Also, there's a built-in.
Let's hold off
amount-
dialogue. I mean, I know, he's the attorney kind of jumped in, but let's hold off till after consent and then we'll have an opportunity. Mr. Giuliano, if you'd state your name for the record, what item you're speaking on.
My name is Glenn Giuliano, and I'm a citizen and taxpayer in Manatee County, and I did hand in 4 comment cards. You should have them.
On consent agenda items? Oh,
31, 36, and 57.
thank you.
So we'll start with 31. That's 17 pages long. 17 pages of uncollected debt. Now, we heard the other day in a workshop that there might be an alternative method before these people go to the ER. Lieutenant or Captain Critchfield did an excellent presentation. What if we could reduce that cost? This would be self-funding. If we just took a portion of the people that didn't need to go to the ER and implement Mr. Critchfield's plan, and I suggest you do it, not do any more studies on it. You don't need to reinvent the wheel. It's a great program. In addition, I sent you each another program out of North Carolina for the mental stability of the folks that are being picked up with ER and how they can be diverted as well, which is another excellent program that you all have. I sent you in a PDF. So that is worth looking at. I think the cost savings on that would be substantial. The other question I have is the collection. So it goes to a collection agency, is that correct? Do we get any of that money back? Can anyone tell me that? Do we get any? We do. Okay, so the taxpayers have basically forgiven $356,000. That's just this month, $10,000 a day. The problem that I have is that you're never going to collect the money from the indigent. I get that. We write it off. But what about the poor working stiff that doesn't have health insurance or is underinsured, and he needs that ambulance ride once, and he's worked hard all his life to build equity in a house? Then you send the dogs after him to collect everything they can, get a judgment against his house, and you bring him into destitute. The number one bankruptcy in this country is over medical bills. So you give the indigent, who ain't got a pot to do anything in, a break, you write it off, the taxpayers take care of it, and the taxpayers who pay the taxes that use this maybe once or twice and aren't frequent flyers like so many we have at the ER, get hammered. It's not fair. If we're going to write it off, you need to write it off across the board, particularly for the taxpayers. So we'll move on to 36, surplus equipment, and I certainly won't take that long. Oh. I did have one question on the billing there. Every month, this is like $1 million difference between Medicare and the amount allowed. Why such a large disparity? I don't get it. I mean, this goes on month after month after month. I mean, are the doctors overcharging? Is Medicaid not paying enough? I would like somebody give me that answer, please. All right, so on number 36, surplus equipment, I've gone over that several times. It's amazing that you have dozens and dozens and dozens of Dell computers that are working poorly or their time's up. So how does that work? Don't we have a tech department that can clean up those computers and make them run faster? I mean, I got a 22-year-old E-machine that I still work off of. And these are Dells. These are commercial Dells. These are good computers. So I don't know why we just have to, because they're 5 or 6, 2007, 2008, they're a couple 7 years old, that they can't be refurbished and put back in the workforce. I mean, how much high-tech stuff do these computers need on day-to-day application for our employees? So I just question how they all come up at the same time, in the same month, that they're all not working. So that's my spin on that. Now, can I go to number 57? The addendum. Addendum that I heard?
It's 57, no, it's not, it's on the regular agenda, so you have to wait.
Oh, I thought you said 57. No? When is the addendum for the healthcare coming up? For Manatee Memorial?
That's not 57, so.
Which one is it?
55.
Okay, can I talk on that?
55?
Yeah.
It's up under number 15.
There's 55 on the consent agenda?
It is.
Yes, go ahead.
So I can talk about
Five.
it. Okay. This makes considerably more than 3 minutes, but here's the contract. On the surface, it seems like it's a good deal. And you have to restart my clock. I mean, I just started this.
Go ahead.
Thank you. On the surface, this seems like a good deal. Here's the problem that I have with this as I peel away the onion layers of this. Well, first of all, let's go to I asked about the payments of the $4.7 million, and they couldn't give me an answer. So I guess my question is, and there's her email, on several records requests, no other records exist. We make 4 payments to Manatee Memorial, and we don't have any records of it? So I asked for that. So then I went to, well, let's look at the $1 million one. And there's the records request, by the way. 4 quarterly payments. It's in the contract. Looks good on the surface, but guess what? They can't fulfill it. So I have a problem with that. Let's look at the payout for the $1 million, which I also did a records request. And I sent you all copies of it, I believe. As of to date, we've only paid out $331,000. So where's the rest? Where's the rest of the money? Are we carrying that forward? So I said, well, okay, maybe we're late. Let's go back a year. Let's go back a year and give me the payouts of the $1 million of our taxpayers' money and see where that brings us. One page represents $331,000. So I would assume, based on this records request, that the previous year might be 2 or 3 pages. That would be a fair assumption. So what do I get this morning? Oh, you want last year's? It's 32 hours. It's over $700. How can that be? That's a real leap of accounting from this year of $331,000 to last year that supposedly is paid out at $1 million. How can you justify 32 hours when the first page was only $300,000? You would assume the year before would only be a few more pages. I'm going to do a records request to see how they came up with that. So I think it's unfair. I think I know what you guys are doing. As far as collaborating, you said, oh, they just have to make a few phone calls. This is a bad deal. I think you need to stop funding that. And the most egregious is that Mr. Palmer did not address was the second option was Manatee Memorial Hospital, Inc. It doesn't exist. It's never existed.
Did another one.
Are we on the consent agenda still? Have you moved to a different item? Because you
that's
get
the
3
hospital.
minutes per item.
Okay.
We already, yeah.
If
That's
you're
That's the
done and you
hospital.
want to talk on future agenda, you can do on that.
Okay.
But are you done with consent agenda?
Yeah.
Okay. You can
Thank
come on
you.
back up one future agenda if you want to
Okay.
address something on the future.
That's a bad deal.
Okay.
It's filled with errors and misconceptions, Mr. Palmer.
Thank you, sir. All right, we're done with the consent. Anybody else who wants to speak? Ms. Neely, you are had already your 3 minutes per item. How many items did you speak on? I can't remember.
Well, I stopped at the desk and I said I was confused as to the consent agenda, and I spoke to your staff, and they advised me it only went through item C.
All right, you want to speak on item 55?
Yes.
All right, 3 minutes on item 55.
Thank you. This is a contract that's a binding agreement between 2 parties. And from what I've understood briefly about this item is that the hospital entities were not valid corporations when that contract was signed. And you're blaming a Scrivener, which is somebody who just typed it up. Actually, what I understand is those were the names that Manatee Memorial gave you as the entities you were contracting to do business with. And what that boils down to is the integrity, moral fiber of entities, and the fact that we have staffing that didn't validate the entities we were entering contracts with, and it took a citizen to point that out to this administration and to our lawyer. And, they say that both of those individuals, I've heard it repeatedly from them, they don't serve the people of Manatee County. They serve only 7. They're here at the will of 7 people, not the people of Manatee County. And this is not due diligence to have an entity that signed a contract with you that legally doesn't exist, because they're not in the SunBiz record. You have to be recorded as a corporation, as a entity. And those people, those names were not in SunBiz, which is the recording of the corporations. And those are the facts. And what that leads one to actual conjecture, to presuppose, is how much other of our county business is handled just like this contract was handled. You all go by faith, and I think that you can have faith, but then you validate the data. And it seems like maybe our board isn't capable or willing to validate the data, or you just have too much faith in your representatives. Like, I was stunned this year to learn that you gave Mr. Palmer and Mr. Hunziker the power to act in your stead, to do your job. Has anybody asked the state AG, the Attorney General, for an opinion if that is actually a bona fide transfer of our power to unelected officials? And this contract right here is probably just a tip of an iceberg that we, the people, don't know, because the transparency from some individuals in the county is not exactly conducive to answering any of our questions, because public records are just records, not answering questions. Thank you.
Thank you. Anyone else who'd like to address items on the consent agenda only? Now is your opportunity. Mr. Wheeler?
My name is William R. Wheeler. I am a resident of this county. A simple question. The other day, last week, I went out to the new vocational facility on State Road 70, signed up for another course. With surplus equipment, do they get, do their instructors, are they allowed to peruse, go through, or examine any of this stuff that we declared surplus? They may find it quite useful as teaching aids, as metal, as for the machine shop. You don't know if you don't ask type scenario. So do we have an agreement with that school with our surplus equipment that there is something within reason, like older computers that no longer fit our needs? They may be excellent teaching aids, frames off of school buses, I don't care. If the instructor says, I can use that to help here or to gleam metal or whatever, but is there some arrangement that we have with that vocational system that they can possibly get this stuff and save the total amount of money to the taxpayer? That's all I'm asking. I have been connected off and on as a student and even an instructor at one time, Votech, and from my former employer, which is now L3 Communications, we used to donate literally truckloads of metal to Sarasota's vocational school system. They would call us and say, for our welding class, we just need scrap metal that we can weld to show them how to weld. Have we got any kind of an arrangement with that Votech or any Votech in this county? And if we don't, I think we should have it, and if we do, well, then I stand corrected. Thank you.
Okay. Thank you. Anyone else who'd like to address the board on the consent agenda only? Okay, seeing no one come forward, I'm going to go ahead and close the public comment on the consent agenda, with the exception of item number 25, which has been pulled. Did you want to speak before a vote or after?
I'll speak after the vote, but then I want to make a comment.
Okay.
Question.
Okay.
The item 55, that is a good item to bring up, and I'm just curious as to why the name change. Scrivener's error is one thing, but this is a total different name.
An inaccurate corporate name was recited in the original contract. That was recently brought to our attention by Mr. Gibolina. Thank you, sir. Thank you very much.
How long have we been doing business with an illegal name?
Well, the
They've been
contract
doing
is
business.
almost a year old.
Well,
For a year. Well, it has.
sometime in 2014 is when the contract was entered into. I don't recall the exact date. That may be recited in agenda item 55 today.
So the checks
But there
made
is no
out to an illegal
legal
company?
infirmity. Let me be clear, there is no legal infirmity. Manatee Memorial Hospital, quote, end quote, was recited as the contracting party in the original contract document. It's simply that we had the parent corporate name incorrect.
UHS.
It is regrettable. Both parties have been performing under the agreement from day one. There is no legal infirmity. Nevertheless, it is important to get the corporate name correct, and we're correcting that as of today on agenda item 55. Again, thank you, Mr. Gibolina, for bringing that to our attention.
It's under.
Yeah, and you know, these kind of, I mean, Sunbiz, if you go on Sunbiz, you can see how often corporate names change. It's not all that unusual for corporate
It is
names.
important to remember that Mr. DeLallo affixed his signature to the document that recited an incorrect corporate name for his employer. It's my understanding that his legal team reviewed the contract. So it's unfortunate, but again, there is no legal infirmity.
Thanks.
Any other questions on this? before we
No,
take a
just
vote?
the reference about the Waste Pro, Waste Management hauler contracts. There's a built-in cost of living increase, or it's not a cost of living, it's something built in?
There's an escalator clause, fuel adjustment escalator clause that's built into the contracts for the haulers.
There was even a story in the newspaper about it.
Right.
We all
But
remember.
Price of fuel is down right now. Also, regarding travel, that was brought up, I know the commissioners travel a lot. They travel to Tallahassee on their own, I go to Orlando, I go to Tampa, I go to Charlotte County, and I don't put in any mileage, any chits for that. I don't think any of us do.
No.
We don't get reimbursed for our travel, so I just want that on the record.
I can't tell you the last time that I applied for reimbursement for out-of-county travel.
Mhm.
It's been a long time. I'm happy to do it on behalf of the taxpayers.
Right.
And absorb that cost myself.
Right.
We usually take the county cars.
And take the county car. I take the county car.
Yeah.
I drive the hybrid because it's cheapest, usually when I have to run up to Tampa for a meeting or St. Pete.
In my case, it's my personal vehicle.
Right, I take
And
my
I
own
do not
car.
apply for mileage reimbursement.
As well. Yeah, I don't apply for mileage
I
reimbursement.
went one time with Mr. Brown to a meeting all the way up in Tampa, and he took me in the company car, but that was the only time.
Okay, and we're done with discussion on the consent agenda. What's the pleasure of the board?
So moved.
Second.
Okay, we have a motion and a second. All those in favor signify by saying aye.
Aye.
Mr. Bustle, are you there voting aye?
He has to take it off mute.
Larry, did you take your phone off of mute to vote aye? All right, well, maybe.
Wait, there's a delay,
Yes,
too.
I am. I vote aye.
Okay, thank you.
Yes.
All right. And,
Can you hear me?
yes, we can. Thank you, Larry, for weighing in. The chair votes aye, so motion passes unanimously. All right.
I have a comment.
Now we can have some comments. Commissioner Whitmore?
Well, I just have to clarify, Ms. Neely, she was talking about the write-off fees. I just have to say something. My husband is a medical provider for 20 years that I've been married, 21 years that I've been married to him. And knowing what the EMS thinks, you just assume when you're writing off bad debt, it's for indigents, and I'm kind of insulted. There's elderly that have no Medicare supplement. After you bill them 3 or 4 times, and they can't even afford the medicines you think they're going to pay their ambulance bill. You write off that. You have people from all over the world that visit here that don't end up paying their bills. You have people that have out-of-pocket expenses on their insurance and they just don't pay it. So to say it's just indigents really bothers me, because I know for a fact it isn't. And I know Ms. Neely said publicly last year, maybe it's different this year, that she doesn't have insurance. Well, if she ends up in the emergency room and she has like a $50,000 bill and she said she's going to pay it, and I have no doubt that she will, she's also going to have an ambulance bill. I know my husband worked with these people that had, like Glenn said, that are low income, and he said, pay me $5 a month, and they did for years. But it's just your responsibility, I agree with her, to pay your bills. But to say that it's all indigents, it is not, and that's the real world. And that's all I'm going to say. That just really bothered me, because we assume when we write off bad debt, it's all poor people, they're living on the streets, and I just can't handle that. Or the working poor, and it is the working poor. And hopefully they'll make their payments, and if they can't, we end up writing it off. But these people do try to go after them, and they do make payment. I actually use that I think, well, the previous one, I used our collections agency, which we had before, and they would take $5 a month from the patient. So it's not like that they demand all the payment. So anyway, I just wanted to clarify that because I don't think that should go, hearing that on television and let the public think that all this money is just for indigents, and or how some clarify as indigents. It's also our citizens that can't even afford a supplement, a B, that they get the A and they don't have a B. So, I just had to clarify that.
Well, and I just want to comment, follow up, Carol, on that, what you're saying, when we say indigent, and this information is available. It's readily available as to who these bills are being paid for because we have it listed, the collections are listed in our backup material. And we have to be careful when we say it is just the indigent. Who are these just the indigent? They're people that can't pay their bill. They might be working poor.
Yeah,
they might very well be working poor and retirees, or people that have these huge deductibles.
5,000.
That, under Obamacare have these huge deductibles and they're not going to pay it. So I think we have to be careful when we throw around words like indigent. Who are we talking about? We can't talk about providing services to people without knowing exactly who they are, and I think that's important that we're going to get that kind of information in our study so that we don't just create these labels and say, we have all of us paying for all of them. Who are them, and who is really paying, and what are they paying? So I appreciate that comment. Commissioner Barr.
Yeah, just to add a little bit to that, one thing that I did want to mention, because I looked into the ambulance bills as well that we were having to write off. And one thing that stood out to me in all of this that you don't really hear about a lot of times is that sometimes people, when they're in the ambulance, they don't leave the hospital,
True.
or they don't make it back home. And so a lot of what we end up writing off is that type of situation. So I agree. I think it should be looked at, and I think we should, and I've asked this question, I've said this many times, it is something that we need to look at, and we need to try and collect as much money as possible, because the taxpayer does pay a lot of times for this service that we have. Adding to that, talking about the doctor bills for last year, I just found out yesterday in my briefing how much money we had spent so far this year. I was surprised at the amount because I had heard that the $1 million that we always set aside was gone in April. So I'm really confused. So I wouldn't mind having a list from last year of the doctor bills that were paid. Bar bills. Ms. Neely, I think about that often, I have to tell you, but I don't drink that much. But I would never, and I can only speak for me, I don't know what others do, but that coming up, I just want to say I would never.
Food allowance.
It isn't allowed to be paid
No,
for under our.
I don't even know. I've never.
You get like
Not
a
allowed to pay for
$24
bar
a day
bills.
for dinner.
I mean, I wouldn't want that rumor starting because I don't think it's true and it's not fair. And last but not least, the contract with utilities has been explained. I was going to mention that, but I think we've gone over it. Last but not least is the comment about our employees. Yeah, I do take that personally because I think the people that work for this county are, a lot of them, the majority of them are Manatee citizens, just like everybody else in this room. And they've suffered quite a bit too in the last few years. So to, talk about them negatively, I don't think is fair. I think that we've had some great employees that have stuck with us through very difficult times, like any other business. And they should be praised for the work that they've done and the work they're still doing. So, just to say, most of them are Manatee employees just like everyone else, so that we're talking about. So I just wanted to mention that. Thank you.
Mr. Hunsaker.
Commissioners, a question was raised about the collection agency. In the spring, we went out for a request for proposals, and in June, we awarded a new contract for collection services to a firm called Professional Recovery Consultants. So we do periodically go out and go into the marketplace for updating those services. Secondly, as it relates to our employees, yesterday morning we went out to the beach to dedicate a new piece of equipment for our beach rescue folks, and we were visiting with the staff that works out there. We had one of the lifeguards that Ms. Wyndon spoke with that loves his job, loves working for Manatee County, loves our beaches, but left for Sarasota County for $4 an hour more. It's a struggle for all of our employees. They like working here. They enjoy the place. They enjoy the freedom that we provide them, but $4 an hour is $4 an hour. Thank you.
Thanks. County Attorney?
Thank you, Madam Chair. Just to follow up on the citizen's comment regarding the hospital-related litigation emanating from Sarasota County. That was, in fact, a Second District Court of Appeal decision handed down on August 14 of this year, styled Venice Regional Medical Center versus Sarasota County et al. We have provided all commissioners with commentary on that case previously, but I will again repeat that appellate court decision is restricted to the unique situation that exists in Sarasota County and Sarasota County only. Their indigent health care situation is governed by a special act of the legislature that does not exist in this county. And finally, if it was true that taxpayer money could not be spent on indigent health care, then there wouldn't be a state statute on the books that allows referendum for half-cent sales taxes for indigent health care. So, again, I wanted to clarify those points. Thank you, Madam Chair.
And to that point, I mean, Sarasota County spends how much approximately on indigent health care?
50 million.
Madam Chair, I do not have those figures in front
County
of me.
Administrator, you know roughly how much that taxing district in Sarasota County collects for indigent health care?
In excess of $40 million.
47 to
Well, that's what I thought. And they spend
every bit of it.
all of that money in indigent health care. I think the lawsuit was, don't make us spend more, that you already have this tax that's being collected to spend for indigent health care, to now hit up these other hospitals for more. I think that was what the lawsuit was about, and, I don't blame them for suing on that.
Madam Chair, it should be noted that in Sarasota, where you're talking about, the cost factor is there because it's a public hospital.
That's right.
Sarasota County owns the hospital.
That's right, and the fact of the matter is, they said the private hospitals didn't have to also pay for that when there is a public facility that does spend $50 million or so on healthcare. So.
Yes. Sarasota Memorial is a taxing district within Sarasota County.
Okay.
It appears on every Sarasota County resident's tax bill every year.
Yes, it does.
Okay, Commissioner Whitmore.
And if you ask Brenda Rogers, she'll give you a list of the doctors last year, because I did a few months ago, and I got a list of all the doctors that got paid last year. You got to email Brenda Rogers, and she has that. But I had a neurosurgeon, and there's only 3 in town, so you can guess what, there's 3 of them, called me and said, I've got to do surgery on a patient, and I'm just never getting paid. And he goes, and the patient has no money, and I says, well, has the patient qualified? And so I sent him through the process. Well, the county had submitted a contract to all the doctors last year, and they needed to sign a new contract. And this doctor had it sitting on his desk. Went, called his secretary, and sure enough, it's sitting on his desk. I said, well, if you guys would sign the contract, you could get paid to do surgery on these people. So he signed it, and he's done brain surgery on this patient, and eventually he'll get paid. So in 90 days, he'll probably get paid. But what you're seeing, a decrease in pay, from what I understand, what he told me, is and he's a big group in town, they hadn't signed the contract. And we made our doctors more accountable this year, that if you want indigent care monies, you have to sign a contract, and it was a different contract than normal. So we made them hold more accountable, and that's why you're seeing the decrease in money. Just one guy a few months ago called me, and he hadn't signed the contract all year. So that's where I'm thinking some of the money is why you're seeing a decrease this year, but I'm not an expert at it. Just one case.
Commissioner Smith.
Yes, Madam Chair. And most of you touched on it. The thing about emergency service, for example, about 6 months ago, I had a gentleman call on behalf of his father, 80-some years old, worked all his life, has outlived his retirement. Mm-hmm. And God bless him. People are outliving their retirement. This individual 3 times in 1 month had to use emergency services. Deductible was high. It paid part of it, but not all of it. So we're going to continue to run incidents like that. I don't think we should be chasing someone 85 or 90 years old who's outlived their retirement. These are elderly folks, been successful. You know, so God bless those individuals, you know, that have outlived their retirement. Times are changing. These are not just poor people. Most of these people worked all their life. And let's talk about the working poor. The working poor could be someone making $25,000 or $30,000 a year that fit this category, but they're working. It's not people who freeload or anything like that. And we're talking about welfare and all these different things, which we have no control of welfare. This board doesn't. But the facts are that people are living longer. And so the whole concept of the emergency services is to provide, they can't arbitrarily decide who goes and who don't. Rich, poor, black, white, they don't make that decision. In the health field, if you're sick, you get in. We hope you pay. What are they recommending? If someone 80 or 90 that can't pay, that we should quit picking them up? I just don't know where we go from here. It makes no logical sense to me. No one wants to be sick. You think people really want to freely get into the ambulance and go to the Manatee Memorial, Blake, or whatever it may be? No, it's not fun. It's not fun seeing your loved one go. Because you know you got to deal with these issues, health, and all this stuff that goes with it. So it's a process that we have to deal with as elected officials. And so I just want to put that on the record. Okay. Now, let me comment on this here. I don't know of any commissioner. We don't get local travel money. We pay for our own gas in Manatee County when we go different places, out of our own pocket. As we travel across the state, it may be something different, but we don't have a local expense account. When we run to these meetings, we pay for our own gas. And so the idea that a commissioner can't travel or shouldn't travel, or a county administrator or a county attorney, and we run $1 billion government, and we can do it on the internet, who are we kidding? It makes no logical sense whatsoever. I mean, it's really what I'm hearing in here, and they have a right to say what they're saying. But in the real world, we have to deal with people. In the real world, you have to meet with people. In the real world, you have to travel and get information that can help Manatee County. And so our job is to make Manatee County better. I have issues with Manatee County government. Don't misunderstand me. And some of the stuff they talk about, I agree with. But we're in a real world, not a world of theory. This is the real world. We're dealing with people's lives, livelihoods, and we may not make the best decisions, but we do the best we can. Thank you, Madam Chair.
Thank you. Commissioner Chappie.
Yeah, it was also mentioned with regards to, I believe it was referring to when we're on recess and the resolution we passed to give the county administrator the authority to act. And I just was hoping that maybe you might just chime in just briefly and explain a little bit about what that's about and limitations and what you do and cannot do.
Well, the board has adopted a resolution that during the recess, we can take action to keep this government moving. And there's limits to those actions. And they're mostly for routine activities that the government enters into on a regular basis. And all of that is confirmed when the board comes back from recess. We put an agenda item together that identifies all those actions that were taken during the recess for the board to confirm those actions, because we just can't shut down the government during the board's recess. There's business that needs to be taken care of. And all of that routine business is ratified by the board upon the return from recess.
Thank you.
And those criteria are specifically established in Resolution R09-161 for anyone who wants to study that document and see the various restrictions that are placed upon the administrator.
Thank you. And once again, we encourage all of our citizens, if they have questions about things that are on our agenda, if they have questions about how things are operated, about contracts, about who's being paid for what, we have a process for that. It's called our Citizens Action Center. It works extremely well. We make sure that you get in touch with the right staff person, that they can provide you answers. There is a process for you to get all the information. It doesn't do any of us any good for the citizens of this county not to have the information they need about how this county is run. if you have a problem after going through that process and it's not working, then you probably might want to come to our meeting and tell us that for some reason you didn't get a response. But you can see we take a lot of our business time. Folks that are sitting here with business items have to wait, but it's an opportunity for you to get from the staff, who are the people that work on these issues every day, to get information if you go through that process. And again, I would encourage everyone to please do that.
Madam Chair, in addition, we have the clerk of the court that monitors all these activities. There's the internal audit function under the clerk of the circuit court that monitors all these functions. All these processes are well defined. They're in writing, approved by the board. Annually, we have an audit by an external audit firm that will report on any exceptions to the policies and procedures and issue a public report on exceptions. To date, in the years I've been here, that has been a very clean report to this board, clean being defined as no exceptions. We're very proud of the process we have. It's indicative of the credit rating that counties enjoys, that any inference that there's something nefarious going on in this government should be should not be taken lightly.
Madam Chair, if I could add to that, and Angel, our new clerk, is over here nodding her head in approval with Ed's commentary. Angel employs a team of certified public accountants over there in her finance division, and they go through every county expenditure with a fine-tooth comb. If an employee submits a reimbursement tab that has any questions associated whatsoever, they're going to be getting a phone call from someone in Angel's office saying, hey, I've got some questions about this. So the fact that the clerk's office independently audits a variety of county functions on a routine basis. And so yeah, I mean, it bears repeating that we have an independently elected clerk of the court that oversees every financial aspect of this county government and every penny that is spent. Thank you.
Okay. Do you want to move on to citizens' comments, or Commissioner DiSabatino? And
Just time certain. Don't we have a time certain?
Yeah, we have a 10 o'clock term.
Oh, I'm sorry. Gosh,
Yeah.
thanks for reminding me.
Sorry.
I'm sorry, whoever was here for the 10 o'clock time certain. Do you have something else you want to add?
Just,
before we move
it
to
was
that?
brought up at a recent meeting that our county attorney has authorization to settle suits up to $25,000 on our behalf, correct?
20,000.
20, okay. So does the county administrator have such powers or sign contracts up to a certain amount without us having to vote on it? And
We voted on it. It was 100,000, the last one, wasn't it?
so maybe we need to have a discussion on that.
We just voted on it within this.
In your purchasing policy, you have identified the authority of the county administrator, and I can't recall what that number is at this point.
It's 100.
Yeah, let's bring that back. If you want
Okay.
to say that for Commissioner comments and direct something specifically, that'd be good. Commissioner Shappy?
Yeah, and I know we're a little stressed for time here, but I just think to the detail of the accounting services and to the detail of not wanting to waste taxpayer dollars, when one of us might check a vehicle out, we're required to put the time down, the mileage down. Then when we get back, we have to put that down. And this is all part of the record, so that if somebody wanted to check to make sure that we didn't go 120 miles when we only went over to the Lakewood Ranch, it's documented how the time and the mileage that we put on these vehicles that we do check out when we do. But again, a lot of us don't even do that. We just use our own vehicles.
Okay, great, thanks. Let's move to item number 54, which is time certain at 10 o'clock. We're a little tardy. Child Welfare System Advocate Annual Report. Ms. Brenda?
Thank you, Madam Chairman, Commissioners. Brenda Rogers, Director of the Community Services Department. In 2009, Judge Hayworth approached the county to participate in an innovative approach to monitoring and improving the child welfare system, which involves our most vulnerable children who are being abused, neglected, or abandoned. There's no other monitoring system like ours in the state.
The systems advocate position is funded through a collaboration with Sarasota and Manatee County. Laura McIntyre has served as our systems advocate for 6.5 years. She has 15 years of experience in child welfare. As the systems advocate, she's been a crucial part in the oversight of the system in Circuit 12. Laura is here today to present the Child Welfare Systems Advocate Report for Manatee County.
Good.
Thank you. Thank you for being patient. Sorry to make you wait.
Thank you.
Thank you for having me this morning, and thank you for all the hard work that you guys do. I appreciate it. Sorry, I'm a little nervous. How if that extra time gave me time to be nervous?
Yeah.
Nervous.
That's all right.
Okay.
Yeah, totally don't be nervous.
We have a PowerPoint here.
Great.
Okay. They've asked me to kind of do a little high-level overview, too, of just the child welfare system in and of itself, because not everybody knows what happens after you make a call to the hotline. So I was going to do just a couple minutes on that and then move into our system.
We're just getting it up. No, that we all got that.
You did? Oh, it's not on there?
Yeah, see, it's just what goes, it's just the screen goes to the computer.
And then it oh, no.
That's okay, Diane will do it. We have it in our agendas too. There you go.
There it is. Okay,
Oh.
great.
It's an agenda. I should click
Yeah, it's
on
in
it.
our agenda.
It's attachment.
Oh, is there an attachment? Great. Okay, so as you know, the Florida Abuse Hotline is utilized when citizens believe a child has been abused or neglected, has knowledge of abuse or neglect, or witnesses a direct event of child abuse, neglect, or abandonment. And these calls need to be made in good faith. I mean, you don't want to, it's not used as a mechanism of retaliation. And back in 2012, if you all remember, after the Sandusky scandal, it became a felony not to report these cases of abuse and neglect. And these hotline operators that receive the calls receive really specialized training to screen in or screen out the call. They determine what warrants an investigation, and if they're not screened in, if they do record them in the system so that if other calls do come in the future, which they often do, it's documented the family has a history in the system. So if the abuse report is accepted, it moves on to the Manatee Sheriff's Office and their Child Protection Investigation Unit. And Manatee County is really unique. It's one of 6 counties in the state that actually has the child protection investigators housed within their organization. And this provides an unbelievable partnership. So when investigators are going out, they have law enforcement with them at the same time. And, often, these families were dealing with domestic violence, drugs, guns, heroin overdoses, as we've heard. So it's really important to have that partnership and that collaboration. And here's a little kind of outline as a call comes into the hotline. As I mentioned before, they either get screened out where it doesn't quite rise to the level of an investigation, but it is documented in the system, or it's screened in, goes to the sheriff's office, and then the investigators make a safety determination. Is this child safe in the home? Can they remain in the home? Maybe they don't really need any services. Maybe it was just a call that came in out of a concerned citizen and there really was nothing found. Or sometimes they can remain in the home and be safe, but the family might need a couple of referrals, like child care referral or perhaps to a service agency locally that you have. Or they're deemed unsafe. And they can go a few different tracks if they're deemed unsafe. They can either remain in the home under a non-judicial diversion type program where case managers will provide referrals on a short-term basis to a family and ensure that they follow through. So say there might be some substance abuse issues, or maybe there's domestic violence and the perpetrator leaves the home and they put a safety plan in place. And they monitor that for maybe 90 days to 6 months to make sure the family's complying with those services. Or they can be in-home judicial, where perhaps they need a little bit more strength to make sure they follow through with their services, which means it still goes before the court, but the children are not removed. There are safety plans in place as well, and case plan tasks to follow. Or, obviously, the most restrictive would be removal of the child. There's just no way that the child is safe in the home. They had to be removed, placed with relatives, foster care, or non-relative caregiver. And as you see to the right there, the two partners there, the two-partner agencies, the Safe Children Coalition and the Child Protection Team, and I'll talk about those in the next slide. The Child Protection Team is a statewide program operating under the Florida Statute 39.303 in order to support the state's child protection investigation services. They work to evaluate, determine the existence of child abuse or neglect. So there are certain cases that are mandated that the child protection team has to review: sexual abuse, physical abuse, medical neglect, emotional abuse. They're also an amazing community partner to coordinate services for child victims and their families. They increase public awareness, so they do a lot of prevention work in the community. They increase the knowledge and skill of professionals who work within the realm of child abuse. They provide trainings on an ongoing basis to professionals locally. And they advocate the need for treatment and prevention resources. The Safe Children Coalition is under the Sarasota Family YMCA. It is the lead agency for community-based care in Sarasota, Manatee, and DeSoto County, Circuit 12. And actually, this area was the first area to privatize child welfare in the state of Florida. So yet another thing to kind of unique that we've done here. They collaborate with local agencies. For example, as a lead agency, they contract with Centerstone, formerly known as Manatee. I'm still getting used to that, Manatee Glens, and Youth and Family Alternatives to provide that case management oversight for child welfare. They provide the continuum of child welfare services for those children who have been abused, neglected, and abandoned, just like I mentioned, the non-judicial, judicial, and diversion. So the ongoing case management, for example, case managers will provide referrals to substance abuse, mental health, domestic violence. They make sure that the children are getting all their needs met. They provide referrals for developmental screenings, education, making sure they stay on track wherever they are placed. They provide, they do the licensure process for foster care. DCF holds the license, but the local agency does the training and certifications. And as an FYI for anyone listening, we are in a shortage of foster care homes, so please get the word out. Independent living services for children that are ages 13 and up in foster care to help prepare them to be productive adults when they age out of the system. Hopefully they don't age out of the system, but giving them the tools and the skill sets that they need. And on the happier end, adoptions, when the children cannot go home to the families, to celebrate the adoptions of those children finding permanent homes. Just a little snapshot of your Manatee County data. Since January of this year, there's an average of 356 calls to the hotline each month, which actually for the past 3 years, that's been about the same. The shocking thing is, though, as of August, 388 children were sheltered since January of 2015. That is more than the total amount for 2014. The primary reason for removal is substance misuse. 61.3% of the cases of children getting removed is substance abuse. They just cannot be kept safe in the home. And as known recently, starting with the prescription drug epidemic on our way into the heroin epidemic, almost 35% of these are related to opiate and heroin. And 68% of the children are under the age of 5, meaning they are the most vulnerable, the ones with the least amount of voice, and the ones that are most likely, not in child care and visible in the community. There are currently in Manatee a little over, and again, I don't have the September data because we're not through with the month, over 700 children in the child welfare system. And this means the children that are sheltered in out-of-home care, and incidentally in licensed care, so that's foster homes and group homes, we have about 205 children in that setting, almost 250 with relatives or non-relatives, which is the primary choice if we have an option. And then the 250, about that many receiving that in-home judicial or diversion services. We'd like to, push that because we want the least restrictive. We want these families to be healthy if possible. On the upside, about 83% of the children are reunified within 12 months of removal. And that is a state contract outcome that is expected, but we can't always do that safely. So that's actually a very good number. And we are one of the best in the state, what I heard yesterday. Child welfare adoptions. As I mentioned before, it's one of the happier sides of this job. And we had 44 in the fiscal year, so that's July 1st of 2014 to June 30th of 2015 in that year. And while that number is very high, there's also the downside of adoption. Sometimes these children don't make it in those homes. And last year, in that same fiscal year period, we had 3 children's adoptions legally dissolved. And I think I learned recently that approximately 80% of children in foster care have mental health diagnoses. So these children, maybe they were adopted 10 or 15 years ago, are presenting with, some issues that, were not foreseen at the time of adoption. And a lot of these services go away shortly after adoption. So these families don't know where to turn. They don't know what agencies to go to. And adoption-related services is such a specialized field that I'm thrilled to hear that Chosen Families is going to be starting here in Manatee County, which is really a collaboration of 3 agencies that will be working together to address these types of families as they're coming, as they need the help identify what they need and get them immediately into services and even provide some crisis help. The benefits of the community-based care model versus the old days in the state model. The communities come together on behalf of the most vulnerable children. The lead agencies, which is the Sarasota Family YMCA, the Safe Children Coalition, and the community alliances, work within their community to ensure safety, well-being, and permanency for the children and their care. It increases the local ownership of the service delivery system. We're working with agencies and partnerships and relationships that we have with each other, and there's that oversight versus somebody from Tallahassee trying to directly provide that oversight. It increases the accountability, the resource development, and the system performance. So when we have resources that may be lacking, we can come to the table and figure out how we can still serve that need, even though that resource doesn't independently exist. And the foster care and related services are outsourced to competent services agencies. And those go out to, like the YMCA is under contract right now. They had a 10-year contract. It goes out to bid, and if they win it again. Same with the case management organizations like Centerstone and Youth and Family Alternatives. Are they making their outcomes? Are they doing what they need to do? And if not, we need to find another agency. Fortunately, we haven't had to do that here. The community alliance responsibilities. Joint planning for resource utilization in the community. So funding coming from DCF and local funding sources, the Community Alliance provides that oversight. Are the funds being used appropriately? Assessing and establishing community priorities for service delivery. Currently, we're working with University of South Florida, Sarasota, Manatee to provide a needs assessment and also to really dig into the cases specifically to Manatee on the increase in removals that we've had here locally. Serves as a catalyst for resource development in the community, providing community education and advocacy on service delivery issues and promoting prevention and early intervention services. And locally, and as you heard Brenda mention earlier, Judge Hayworth was the one that decided that our community alliance needed to be stronger than the rest. He formed the Family Safety Alliance, and this is this community organization responsible for that oversight in Circuit 12. It's in statute, 2019, Department of Children and Families. And it's comprised of invested and passionate community stakeholders concerned with the well-being of the children. Bill Little has been our chair, and he just recently resigned. I guess retirement got the better of him. Karen Winden, we are so fortunate to have her as our vice chair, and she's been an incredible leader. Joan Geyer, we have members from the Children's Services Advisory Board. We've got Monica Osborne and Kim Kutch with DCF. Major Connie Shingledecker has been an active and instrumental piece of our membership. We have membership from the Health Department, Juvenile Justice, and community at large. This model wouldn't work if we didn't have people who are passionate at the table to make sure that these outcomes are being met and that really want to drive and make the system better locally. The FSA, the Family Safety Alliance, entered into a memorandum of agreement with the Family Safety Alliance, the Safe Children Coalition, YMCA, and the Department of Children and Families. It's to facilitate information sharing, communication, and community partnership. This is the only model MOA in the state of Florida between these types of partners. And Secretary Mike Carroll has touted it as being one of the models for the state, and he has said that over and over again since its existence. The systems advocate position, as she mentioned, this began in 2009. It was formed really to create a sense of transparency for the community. You know, many things often happen, you hear about it in the paper, but then you get to know nothing about it. This role that I've been privileged to serve in for the past 6.5 years, you know, I have access to all the same databases as the workers that are in the system. So if critical incidents happen, I can go in, investigate, and report back non-personal information, but, you know, systems issues. If there's systems issues, if somebody didn't fail to do their job appropriate, things like that, I can report back to the Family Safety Alliance and the public. And I serve in all 3 counties, and the funding is shared by Manatee and Sarasota County. An innovative approach, and again, Secretary Carroll has also mentioned this many times as a model for the state. For example, I can receive and review any child welfare-related complaints and concerns. Often you hear that foster parents are unhappy with case managers. Case managers are unhappy with service providers, or parents are really unhappy, or it can come from anywhere. I mean, Judge Hayworth gives out my card like every day, to cases that he thinks I might need to look into. And as an independent diplomatic review, you look in, you pull all the pieces of the case together from all sides, and then try to resolve it in a diplomatic, behind-the-scenes type of way. And it's created a sense of trust within the system. Every month, the Safe Children Coalition, Manatee Sheriff's Office, and Department of Children and Families create data performance reports. Those are reviewed in a timely manner and shared back with the Family Safety Alliance for their review. We look at trends, we look at issues that might be of concern, and also compare it to statewide data. Any critical incidents, if a child is injured while under the supervision of the Safe Children Coalition or under investigation, or worse, if a child dies, those are looked into immediately and in timely fashion as well. I serve in all the death review teams for all 3 counties as we look at lessons learned and also to look at how we can prevent future deaths. And we look at systematic changes to improve the overall system of care. We review best practices and how we can implement them locally. We look at statewide initiatives, and as those come down, often this area is looked at as a pilot area to roll things out, such as the model courts, evidence-based parenting programs. We've been working with on that for the past couple of years with some success. We look at system failures, too. We want to learn from other people's mistakes so we don't have those happen here. And we facilitate community collaboration across multiple systems and provide that subject matter expertise in child welfare. I work closely within the behavioral health system, criminal justice, education, medical health, to make sure that everybody has the right information. We're all sharing and collaborating together so we're not functioning in silos. And I provide child welfare system updates to community partners, to county commissioners, and I provide trainings locally as well. And that is it. There's my contact information. Do you all have any questions?
Okay. That's a lot of information. Thank you.
Sorry.
Carol.
Well, thank God for your organization, but 388 kids have been taken out, 68% of them under the age of 5. Substance abuse, the heroin epidemic that Manatee is kind of like the epicenter right now. I can get that. And then they're going, when they try to get service, they're going to a methadone clinic, which is more pain meds. And you have the vicious cycle. I feel for you. I have a question before I make a comment. The adoptions, you said there were 44 adoptions, and I have some friends that are thinking about it, but then they hear, and I don't know, and it's good for the public to know, that there's a certain time frame that the families, once the process starts, can have their child back. Is that true in Florida?
Only when they have not had their parental rights terminated. So if the parents are under, the children are removed, they're given a case plan, they're given referrals, they have to do what they need to do, substance abuse treatment, mental health treatment, et cetera. If they don't follow through with what they need to do, the process then starts for termination of parental rights. That can also take time, too, because you have the parents' attorneys filing motions saying, no, they're doing the work that they're supposed to, or the state's saying, no, they're really not. So there could be some delays. It does take a while sometimes. In the best case scenario, parents will sign their parental rights over, and that can speed up the process, but it can take some time.
Well, and I also talk about this. I had very abusive parents, and today I would have been taken out of my home in the criteria today. But thank God I had a community that actually took me in and gave me a place to live. And but that, and I know we always hear at our meetings, well, we need to work on the families. Well, it was happening back when I was younger too. So, but to have something for somebody to go to now where we didn't in the past. So I'm very passionate about this. There are some parents that unfortunately don't deserve to even have a child or anything, and hopefully that some can go through the process, and it usually comes from your parents, what you learned, and the cycle goes on and on. So, and I'm glad there's counseling and stuff, and we do want the kids with their parents, but sometimes it just isn't going to ever happen. And then for those that want to adopt, there's that option. So I think maybe the county could do a better job at educating the public on, the adoptions, because there are a lot of people that really have considered it throughout the years that I've talked to, but they're just afraid that they're going to get emotionally attached and then the child get taken away. So maybe we could do some kind of public education on our educational channel or something. I don't know. That'd be something for the public. But thank you for what you do, and as you would probably guess, I support you 100%.
I appreciate that. Thank you very much.
And I did just want to ask a question, and I'm sure the answer is probably lots of resources, but when folks have had adopted children, and I looked at those three, and it's just, having raised teenagers,
Yep.
Many of us would probably like to give them up, but.
And at that age, 14,
I was probably
15,
one of them,
17.
so.
But the fact of the matter is, it just is heartbreaking to me to think that someone who's been in a family for 10 years, and now they're 17, to me, that's you're just saying, problem. Are there resources to those families to try to keep them together?
There have been, the adoption-related services, it's a very specialized training that they need locally. It's Manatee County, and I think it's effective next week. Chosen Families is going to be the organization that you guys are funding, if you want to speak to that. Yeah.
I just want to say that you have approved, I believe this morning, a contract for adoption services. If you didn't approve it this morning, it's coming in at the next meeting. But our Children's Services Advisory Board looked at this issue and identified it as a need in Manatee County for services for adoptive families. We chose to do an RFP, and we did have agencies submit proposals. The thing that we felt was the most important, that the CSAB felt was most important, was that just the identifying factor of being an adoptive family should qualify you for these support services. And so we don't have to wait until the family's in crisis before they can seek help. And we'll have more to report on that program as we move forward. But it is a new program that will be rolling out starting October 1st.
Well, good, and it's important for these families to know that there are places they can turn for help, places they can go and talk to, and, it really is something that sometimes I think is missing for parents of teenagers, that there are places that they can go and talk to, because, every parent goes through this. It's just, how do you get the best resources to try to address these problems? So, any other comments?
Good job. Yeah.
Okay, well, thank you for the work you do. I know it can't be easy to do this kind of work, but yes, your passion is evident, so we appreciate you taking this on. And
all you do.
And I know Connie Shingeldecker, Connie and I were in Leadership Manatee together back in '94, and she is really incredible asset for this community and working in this area, and I know she's one of the reasons that we started this program. So,
and she doesn't plan on, even after retiring, stopping.
Good. I'm glad to hear that. I don't want to be giving her any plaques or anything.
She does, so.
Plaques, yeah.
Okay, thank you very much for being here and the work you do. Okay, next up, we're going to go back to citizen comments on future agenda items. Again, you'll have 3 minutes. Again, I encourage you, if you have things you want staff to work on, work with our staff, not just coming here, but I will give you your opportunity to speak to the board for 3 minutes. If you'd like to come forward, Mr. Gibolina, I have you signed up for a bunch of things. Please come forward and
He's coming.
Ms. Neely, I don't know if you want to yield your time. You guys can figure out who's going to get the microphone first.
Glenn, you signed up.
Okay. And you'll have 3 minutes per item, and please let us know when you're switching items.
Okay. Future agenda items. I want to thank the last presentation. That was very good. I'm just going to talk about that briefly since there was no public comment on that.
Technically, Madam Chair, since there was no proposition before the board, there is no statutory entitlement for citizens to comment. I just wanted to make that technical point.
Okay.
Okay, then I'll talk about future agenda, the future of foster care in this county. We are fortunate to have such an elite crew of foster care implemented. I cannot say that for the rest of the state. It is a wrecking ball. And being involved with the family courts, I would like to see the breakdown of the ages the nationality, often there's a higher percentage of black families that are broken up because they adopt one or two out only. The other thing is, on the 44 children, I would love to see an anonymous letter from each of the parents. The termination of parental rights is huge, and I sit in family courts, so I know what goes on there, and it's not a very pretty sight. The second issue I want to bring up on that is that the 80% of children have mental health issues. You bet they do. They're being ripped out from a family, whether they mandatory need, and I believe in many cases they have to be removed. But that's still traumatic. And if they're going to go back to the parent in 12 months, typically the foster care, and I'm not saying the 12th because they have an outstanding, but I travel around the state. I look at different districts. I interview people on the foster care system. We had 533 deaths in the state of Florida in the last 3 years in foster care. The rest of the state is atrocious. We're fortunate to have this here, but I still would like some clarity. And the other problem is that if the parents are working a program and they're done in 12 months, foster care is going to know to do that. They're getting paid very well. They're going to try to, I'm not saying this, but the rest of the state, they put them on psychotropic drugs. They keep them drugged out, drugged up. They have a higher percentage of school being missed. It's not a very fair system. We are fortunate to have what they have here. So that's all I'm going to say about that. My second item is being on the Affordable Housing Board. Are we forwarding $3 million? Am I to understand this correctly, that $3 million we sat on all year, and we're forwarding that to next year? I mean, we've got vets that are homeless. We have millenniums that are looking for housing. We have a housing crisis for the working stiffs here. Why is that? Why are we sitting on that money? What are we doing with it? To roll that forward another year and not have the millennium or our vets benefit from over $3 million, that's a travesty. I think that really needs to be looked at considerably. Let's talk about the library, the law library. I've got a real issue with this. We're spending $150,000 a week. I'm sorry, $3,000 a week in magazines and books. The last one bothers me is memberships. So I have done a records request to see where that $150,000 goes. So it'd be interesting to see where it goes because I just want to know where it goes. I don't think that kind of budget is on the taxpayers since most of the pro se litigants don't get down there. It's interesting to see where that's going to go. And speaking of the law library, I am also on the advisory board for the Veterans Court. And 2 weeks ago, I sit in on the Veterans Court, and it's a great program. If you've ever been to it, you will know that it is on the second floor. The second floor, between the courtroom doors and the windows, is like this. You go up to the third floor to family court or child support, it's wide open. There's plenty of benches. They've got private conference rooms to talk to. Drug court and Veterans Court does not have that. It would be nice to have a place to go and sit down and talk about your case when everybody's out in the hallway. But that opportunity was taken away when the conference room downstairs from the Manatee County Bar, Mr. Palmer's 5-page lease with them. I don't know how you did that telephonically or I still have not looked at that. And by the way, I am engaged. I'm engaged with the judiciary. I was at a conference this last week, and the technology has gone by leaps and bounds. So it's there. We don't need a lot of other stuff to go on there. But getting back to the conference room, since it's closed to the public, I think you need to revisit that issue. Because what I did is I did a records request. No, I didn't. I just went upstairs. I said, let's see how often the Manatee County Bar nonprofit is really using this conference room.
No.
So here it is, folks. The whole month, they used it one day for 4 hours. Now, how does the citizens benefit from that? Do you really think that needs to be in there? July, they used it a whopping 6 hours. That conference room used to be open all the time. I think it needs to be revisited. That's a travesty that anyone that goes to the second floor courtroom and there's no room should be able to take the elevator downstairs and use that. All right, so let's move on to New Pierce. I sent you all snapshots and photos of the road. It's a serious issue. I'm going to take a look at the plans on the sidewalk. It is less than 22 feet. It's 21 feet, 4 inches from the telephone pole. I don't have it with me, but you all have photos of it. And I've left a message with the building department as well. That's unacceptable. We have huge trucks that are rolling through there both ways, not only through my neighborhood, but now from McLeod to Telebast. That is going to be a nightmare. And they just replaced those poles. So when FP&L was down there, I said, can't you move it back a couple of feet? Oh, no. Well, where's it on the plans? Well, we don't need a permit. We don't need this. We'll just take out the old pole and stick in a new pole. Now, I don't know what neighborhood you walk through that there is not some type of buffer between the sidewalk and a commercial road that's rolling down trucks at 40 and 50,000 pound cement trucks, huge tag trailers. There is no easement, no buffer between the sidewalk and that road. That is going to be a nightmare for our kids that are walking from New Pierce to Canaan Elementary. And by the way, I offered Medallion Homes, Carlos, to say, you know what? We'll forego the sidewalk if you would just leave a gate open in the back corner of that development. And they didn't want to do that. And he assured me that that would be a Mirandine sidewalk, and it is not. That sidewalk, currently the way it is unacceptable. It's dangerous. One of our kids are going to get killed. I guarantee it. So that needs to be a serious look at. State-built pavers, that nightmare still goes on. Still goes on 24/7. The pounding, the dust, the dirt. They have not paved their sidewalk. I'll bring photos next time. I'm not going to bore you with the issues. You're all aware of it. But what really disturbs me is, and by the way, that's heavy manufacturing within 50 feet of a residential house. 50 feet. Operation 24 hours a day, sometimes 7 days a week. It's not healthy. I don't think there's a commissioner here that could live in my neighborhood for more than a couple of days. The pounding, the dust, the traffic, it's unacceptable. So that needs to be looked at. Talking about the judiciary, I'm going to bring up a point here that %80 of the cases in Florida are pro se divorce. You know why? Because it doesn't work. Family courts are broken. And until they do some serious changes, and I did talk to some of the finest judges and lawyers in the state when I was at that conference. So, true to my word, Mr. Palmer, this is your copy.
I don't know.
So you can pass that along, and hopefully we can do a better job this year. So, the $150,000 at the bar, the conference room, I have spoken the issues about it. Hopefully you can take a look at it. One other thing, Carol, since you got the last year's list of the physicians and doctors, did they charge you 38.5 hours to get that information? Because I'd certainly like to have a copy of it, of the $1 million that was spent out. So I appreciate it.
Thank you. Please come forward and state your name for the record and what item you'd like to discuss. You get 3 minutes per item, up no more than 10 items. And it does have to be an item that is of the jurisdiction of this board. Recognizing that we don't have jurisdiction over courts. Might not want to talk about courts.
I'm already cut off before I even started. Linda Neely, and I'm here to talk about future agenda item of the obligation of Manatee County board members and employees to the trim notice that is sent out on every taxpayer's tax bill. And it says that each taxing authority body will have public hearings, and I mean, they even regulate the font size on your newspaper articles. So they're kind of serious about it. Yet, when we have our public hearings, we've never had a workshop about public hearings, and I think it's time to have one, because I've come to these hearings and I don't ever really get an answer, and the budget is approved, the millage is approved, and next year comes along and it's the same thing. At the start of the process, Mr. Hunziker read from, I believe it was an 8-page preparatory document. And in it, he made a statement that Sheriff Stubbe was requesting in his budget $2.5 million for freezer space. I called Sheriff Stubbe's office and asked him why he was sitting right there in the third seat over, and he did not come forward and say, that's not my request, because that is what Sheriff Stubbe had his secretarial aide, his left-hand gal, Cynthia, call me and tell me that it was a very brief statement, that $2.5 million is not for my budget. So I tried to find out what the $2.5 million was for freezer space was worth. And I never have had a response. I sent the commissioners the message, I sent emails to all of you asking for an explanation of that. And the bottom line is that you don't answer questions to individuals per se. We can ask for documents, and if we're good detectives, we might find the answers. So tonight at 6 o'clock, you're going to hold another final hearing on the trim, on the budget and the millage. And I still want to know what the $2.5 million that Mr. Hunziker was referencing. It was not written in his written statement, because I did get a copy of that document. And it's something for at the port. And the newspaper. Here we have Port Manatee and pilot program using cold to kill off fruit pests. Could that possibly be the $2.5 million need that was accredited to the sheriff's office? I don't know. I really don't know.
Okay.
And I'd like an
Clean
answer
that up,
tonight.
And thank you for letting us know, and
We will.
hopefully get an answer tonight. Okay, anyone else that, Mr. Wheeler, I'm sorry. You're signed up for a couple items. Please come forward, state your name for the record and what it is you're going to be addressing.
I have 2 items. Put them on the future agenda, do whatever is necessary. Several weeks ago, I mentioned the fact that on State Road 70 at the railroad crossing down near the cemetery, that the chuck holes, which are part of the railroad crossing, are getting very nasty and very hard on people's vehicles. After all, when you hit that, you're hitting a steel railroad track. To the best of my knowledge, I don't know how the system works. I just know that I come to you and you're supposed to fix everything. Don't grin. Nothing's been done, and people are still pounding the bejesus out of the bottom of their automobiles. And if you've gone to get the front end of your car, have maintenance on it for ball joints or whatever, you'll find it very expensive. Now, if it's the railroad's responsibility and costs, and I believe it is, that's fine. But you've got to light a fire under somebody. In fact, down near that intersection, Connie and I were amazed the other day when the trailer broke loose from the back of the pickup truck and went across 3 lanes of State Road 70. What amazed me was after he finally corralled his trailer, I realized he never bothered to hook the safety chains up. But that is getting worse, not better. Those railroad tracks, those chuck holes, you could hit them at 40 miles an hour and lose control, go into the oncoming traffic or what have you. But you're well aware of it. The second item, and it's being looked into, and I freely admit it, I looked into it this morning before I come to this meeting and was assured that it is being monitored. People in Briarwood are still parking on the sidewalk with their cars. They're not pulling all the way up into their driveways. People are going down the sidewalk. I was given a good piece of advice. I was told, get in a wheelchair, Bill, drive down there, hit one of those cars, fall on the ground, and call an ambulance. After all, it's the county sidewalk. It's like hitting a crack in the sidewalk. Now, I didn't think that was too funny, and I'm assured I will not do it. But we have people pushing baby carriages and everything else, and they have to get off the sidewalk, cross the grass, cross the curb, get into the street, go around the back of the car, cross back up to get. And this has been going on, documented from your records as of an hour before this meeting started, since Christmas. Now, it's one thing to be kind and benevolent, it's another thing to be a jackass. These people are professional at promising you, I won't use the words, we'll say used car salesman, I'll pick on them today, promising you anything to get you off their lawn, and they're promising you. And now they have a new trick. Since you cited one of their cars, thank goodness, they simply swapped the cars. That's not the one that's the offending car anymore. They put that up near the house and put the unoffending car to do it. I wish to digress and say one thing in closing. It's not on the agenda. I don't expect it to be. The young lady from the library, it touched me very dearly. I thank you very much for that. Carol, I would like to have a private minute with you sometime on that subject. I was 23 years old when I found out that I've been adopted, and it's only because the Air Force run a very deep, extremely deep security check on me. And the lady who I thought was my mother had to confess she felt she had to. Probably the hardest day of my life. I'd like to talk to you about that. But thank you for, and thank Dr. Martin Luther King. Yes, I owe that man more than any person of color in this county. And I'm as white as you're going to get. But by the passage of the laws that he made possible, being born with a physical defect and being turned down by such people as the General Electric, American Locomotive, Montgomery Ward, all before I was told I was going in the Army because of the war. So I actually went in the Army under the Hire the Handicap program for 10 years. I've had an interesting life, kids. I'm 86 years old now. But I would like that railroad track fixed.
Thank you, Mr. Wheeler,
No matter
for sharing
who
with us.
you got to put the grenade under. Thank you.
Thank you. Is there anyone else that would like to address the board on a future agenda item? Please come forward, state your name for the record.
Commissioners, my name is Philip Brown. I'm the president of your United Way of Manatee County. There are two issues I'd like to address. First, Council, Mr. Hunsicker, didn't mean to not acknowledge you. My understanding is that you are considering creating, establishing, putting to use a couple of advisory committees. That may not be the best label for it, but something in the health arena and maybe something in the financial arena. And I want to encourage you in terms of your, as you evolve as government, those kinds of actions that you're considering are in the realm of making improvements for yourselves. Those are opportunities, and you already use that vehicle, but it's an opportunity to mobilize our community, to take advantage of the assets, some of the thought leadership in our community that we can put to use. It's also an opportunity. It communicates to our community that you indeed are seeking input. It communicates that you're dealing with, frankly, important and tough issues, which is, where we want you to be dealing. And it's also an acknowledgement that you don't know everything, and that these are tough things that you're dealing with. It also communicates that you're trying to deal with a set of priorities. It's about fairness over the long haul. You make individual decisions that advance the common good, and you do it step by step, part by part, So we need to look at your overall functioning, and I think you do that quite well on behalf of our community. It also communicates that the process of governing is as important, the how you do it, as to the actual decisions, right? And it communicates to us that you do care about the common good, right? And we value that in our formal leadership. It also communicates that you're strong, your ego's intact, and you don't need all the power, that you're not giving up your responsibilities to decide. You're simply putting to use the assets of our community on really important issues. So I commend you for that journey that you're going down. So my second issue, which is related, it's just a little bit bigger picture, is the idea of government. We create government as a vehicle to create and sustain community. The idea of government in and of itself is not a bad thing. It helps us create norms, laws, rules, expectations. And it's through those things that we create fairness. We try to create fairness of opportunity, fairness of being helped when you need it, right? And you all are doing that, and so you may get a distorted picture of how we in this community feel about government if you're just taking what you're hearing here. We value that. We value that you as government and as we have a representative form of government, right? We don't have this plebiscite. So we're relying on you to have the big picture in mind. We rely on you to act collectively, right? It's no one of you, and you balance each other out, and it increases the probability of success for us. And we don't always make the right decisions, but we only know that through the retroscope. So, and if you always want to be right and do it right, you may not act, and we count on you to act on the common good, advance the common good. So we value that. We value you, and hope that you will continue down this road of making it even better in terms of how you govern on our behalf, and that you continue to take the risks to do things differently as we evolve that governing process. So thank you. I just wanted to acknowledge that.
Thank you. Anybody else who has something they'd like to have on a future agenda? They'd like to address the board? Now's your time to come forward. Okay, seeing no one come forward, I'm going to go ahead and close the citizen comment portion of our agenda. Items 45 and 46 have been deferred. So we're going to move on to the advertised public hearings, presentations upon request. Would any board member like a presentation on any of these items? I'm going to open them up individually for public comment, but
No.
need to pull them off for a presentation?
Nope, not for me.
Okay. I'm going to go ahead then and open the first public hearing, which is Heritage Harbors ECDD dissolution. This is an advertised public hearing for adoption of ordinance number 15-38. Is there anyone in the public who would like to address this issue? Okay, seeing no one come forward, I'm going to go ahead and close the public comment portion. What is the pleasure of the board?
Motion to approve.
Second.
Okay, we have a motion and a second. All those in favor signify by saying aye.
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 Larry, are you there?
He gets the delayed 3 seconds.
Larry, are you there?
Yes, I'm here.
What do you vote?
Yeah, I vote aye.
Okay. All right, chair votes aye. Motion carries unanimously. Let's move on to the next item, which is
Beam me up, Scotty.
Hey, you hear yourself?
ordinance number 15-39. I will open the public hearing on ordinance number 15-39. This is the Manatee County Court of Ordinances relating to rates, fees, and charges for public utility system. Is there anyone that would like to address the board on this ordinance? Okay, seeing no one come forward, I'm going to go ahead and close the public comment portion. What is the pleasure of the board?
Move to approve the recommended motion.
Okay, we have a motion and a second. All those in favor signify by saying aye.
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 All those opposed, nay. Chair votes aye. Larry?
I hear him.
Larry votes aye.
All right, all right. Motion passes 7-0. Next one is the solid waste rate resolutions. Is there anyone in the public who would like to address the board on resolution R15-55 for revised rates, fees, and charges for solid waste? Okay, seeing no one come forward, I'm going to go ahead and close the public comment portion. What's the pleasure of the board?
Motion to approve.
Second.
Okay, we have a motion and a second. All those in favor signify by saying aye.
Aye.
Larry?
Say it again.
Larry, did you vote? Larry, did you vote?
Yes, I vote aye.
Okay.
Yes.
Thank you. Chair votes aye. Motion passes.
What the problem is here is I have to mute, I have to turn off the
TV.
Yeah.
Technology.
Yeah, we're getting lots of feedback.
turn off the TV
Yeah.
to get rid of the sound in order
Right.
to mute my phone and talk to you. So
Just, if he just turned off the sound to his TV, he could listen to us and then just watch it, because I've
Maybe
done that.
just, maybe you could just turn down the sound on the TV. Commissioner DeSabatino suggests that might work. You just turn the sound down on the TV, we might not get as much feedback.
It's up to you, yeah. Okay, where are we now?
Okay, so motion passes 7-0. All right,
So-
we've got like 5 minutes. I'm going to go a little bit out of order just because I want to take up the
good.
Tiffany Marie Olson Memorial, because that was something that we had before on our agenda, so I'm going to take that just a little bit out of order. if that's okay?
Commissioner, for the record, Maureen Sikora, Assistant County Attorney.
Okay.
And there is a second resolution in the solid waste.
Oh, I'm sorry.
The one that you had just approved,
Right.
I believe, dealt with landfill tipping fees. The second one deals with solid waste rates.
Okay.
So we need a motion and a second on that one.
Correct, that's
Thank
the
you.
motion to adopt resolution R15-56.
So moved. Oh, you have to open it for public comment.
I think I opened the whole item for
Yeah,
public
you did.
comment, just because there's two resolutions. I don't think it needs
Okay.
a separate.
I
Want me
move
to open it again?
Why don't we invite public commentary a second time?
Okay, is there anyone who'd like to comment on R15-56? That is the revised rates, fees, and changes for solid waste collection disposal services based on the franchise agreements. Okay. Seeing no one come forward, I'm going to go ahead and close the public comment portion. Do I have a motion?
So moved. Second.
We have a motion and a second. All those in favor signify by saying aye.
Aye.
Chair votes aye. Motion passes unanimously. Now, I will go to the Tiffany Olson, Marie Olson Memorial.
Good morning, Commissioners. Sajid Kami with Public Works. This request began with a request from Ms. Olson to designate US 19, a portion of US 19 from US 41, the interchange to Palmview, as a Tiffany Marie Olson Memorial Highway. Ms. Olson founded a not-for-profit organization called To Inform Families First, and she's here, and so she'll probably want to share a little bit later when the time comes. But it is designated to promoting emergency contact registration to notify families in case of an emergency. Part of this request, though, there's a process for this item, and the way that it works is the state legislature has to provide the authority, or is provided the authority, to designate highways with a honorary or memorial purpose. It's a memorial designation. It's not a name change. It doesn't require address changes, that sort of thing. It's a memorial designation. To do that, it has to start in the state legislature, and it has to be approved by them, and then they will direct FDOT to install signs once that happens. So this agenda item has two components to it. One is a request to Senator Galvano to go ahead and process that request and put that through the legislature. And then at that point, FDOT would install and maintain signs, and they will look a little bit like... Get the overhead there. It looks a little bit like that. That's what the sign will look like. So it will have Tiffany Marie Olson Memorial Highway is what the sign would look like. The other component that's on this agenda item for this morning is a resolution from you all that says that you support that idea. That's another requirement with the state legislature for the FDOT to go ahead and install and maintain those. They need support from the local government to do so. And that has been drafted by our county attorney's office, and that is also attached. And that specifies that the county supports the designation of US 19 at the interchange of 41 to Palmview as a Tiffany Marie Olson Memorial Highway. And so in short, that is what's before you, those two items this morning.
Okay, thank you. Questions? I don't know if I took you guys off. Questions?
No,
Commissioner
it's-
Baugh, did you have a question?
She's from
No, is it
West
Larry or
Bradenton.
Charles District?
I don't know. By the Skyway, who knows?
Both of ours, I believe.
Okay. Commissioner Whitmore, do you have a question?
Well, I know Christine's going to talk about this issue, and I don't think, and we've talked about bringing this up in the past, so I would like to make the motion to approve both items, and then let her tell her story, because that's what she's here for today. That's what she was here for last time, and I think just moving it forward, I don't think you don't have the support of the board. I don't think you do, but anyway, I would just like to make a motion to approve both items.
Second.
All right, we have a motion and a second.
Public commentary, Madam Chair.
And
We will.
we will go to public commentary. So we're opening it up for the public. Please come forward. Yes.
I guess I would be the public.
Fred.
You know, it's very bittersweet. I'm very emotional because 10 years I've been doing this, and it's amazing how many people have stood behind me, supported me. Every single one of you have believed in this program from the very beginning. That really, literally started on a legal pad as an idea at the Rod and Reel Pier, where I have been employed for 15 years. I didn't even know about making a petition. I just said, this is an idea. Because of the way the accident happened, She was on the back of a motorcycle. She didn't have her purse with her. She had her driver's license in her pocket. It all gravitated toward that license, but it was the 6.5 hours. I literally was watching TV with probably a bowl of ice cream while my daughter lay dead in the street. And that was just unbelievable, because if it happened to me, guess who else it's going to happen to? It's going to happen to the millions of families that live in our state. And then I go to find out it's just not an issue in Florida. This is a national issue. The national average is 6 hours before family members are notified, by no fault of anyone except that law enforcement just doesn't know your contact information. So I thank you. I thank you for this gigantic step. I invite every single one of you to show up when this day happens. I'm presuming it's going to be somewhere in January or February. What I have thought was going to be the state of Florida, and that was going to be it for Christine, has now developed in taking this nationally. I'm proposing it to Indiana as we speak right now. They're very interested. But why stop with the United States of America? We might as well take it around the globe. And it did win an international award, which the state of Florida's Department of Motor Vehicles did say there's driver's licenses all around the world, Christine. And I thought, Tiffany Marie Olson, what have you given your mother to do? I don't know if this will pick up that picture. Does that work or not really?
It will if they put the camera on it. There you go.
Okay, so that's Tiffany. And every day I walk this journey, but my purpose and passion is to make sure what happened to me never happens again. And we are the change, and we're changing the world one registration at a time. Thank you so very much.
Thank you.
Okay. Thank you. And thank you for your hard work. As a mother, I can feel how important it is that you've gone through this so that other people don't have to go through what you did. So we really, really appreciate your efforts.
You know, and really, it applies to you. It applies to Carol. It applies to every single person. You guys all matter to someone, or you have children. And my birthday's coming up next month, and I received the renewal form in the mail, and it is now listed on the renewal form. And that was just a very bittersweet moment then, too, to see what happened there. And it's our state is on display for everyone right now. Everybody's looking to Florida. Our program, ECI, Emergency Contact Information / TIFS Initiative, grows over 1 million registrants a year. 1 million families are getting registered every single year. Florida is exploding with this, and I thank the Department of Motor Vehicles in Tallahassee. I thank every person that has stood behind me. You know, Senator Bill Galvano, he was the first person to step up. Sheriff, Stubbe, he prints all my flyers out of his pocket. He said, here you go, what do you need? So it's an amazing journey. I've met incredible people, and I'm very grateful for the opportunity. But I don't think I'd be walking this path if it wasn't for my faith and my salvation in Jesus Christ, because I know without a doubt I'm going to see my girl again. I'll see her.
Thanks, Christine. Good job, honey. Okay, we have a motion and a second. Everybody okay?
We have a motion and a second. She's going to make
I'm
me
used
cry.
to trying to gloss over the, okay.
Okay, all those in favor of the motion signify by saying aye.
Aye.
All those opposed, nay.
Larry votes aye.
Larry votes aye. Chair votes aye. Thank you very much for being here and being patient with us, because we needed to correct a few little problems that were in the ordinance. So thank you very much.
Okay.
I will try not to cry. I don't know. I'm just tired.
Go for it, girl.
Thank you very much.
Thank you.
Thank you.
All right, we're going to return to our item that got pulled off the consent agenda. This is item number
11:30. Yeah.
Which one was it?
25.
What was it?
25. So if staff would like to come forward and talk about what I think is some very, very good news.
Very
So
good
here you go. You have your opportunity to share that with us.
I need a tissue after
I do
that one. So bear with me here. I do, Kim Stroud, Division Manager for Benefits. Madam Chair, Commissioners, Mr. Hunziker, Mr. Palmer. I am really happy to be able to present to you today because we do have good news. There's been a lot of discussion about health care. There's a lot of discussion just nationwide about what employers are faced with in terms of being able to provide a generous benefit package for their employees, so they're not faced with some of the situations you all have talked about today, high deductible health plans where they can't afford their deductible. There were several comments today about just that theme in general, and what is a working poor, and who are the people who are not able to pay their bills. And a lot of employers are facing that situation because they have to continue to increase their healthcare costs because costs are getting more expensive, people are getting older, people are getting unhealthier, and ultimately that costs a lot of money. I've said to you before many times that we have a very unique health plan. Those of you who have used it know that. We are nationally recognized with this health plan in Little Manatee County. We have been written about in the Wall Street Journal. We have awards from Tampa Bay Business Journal as the healthiest employer. We have awards from American Heart Association. We're continually asked by other counties, public sector, private sector, how do we do what we do and how can they emulate that? And so I wanted just to talk briefly about what leads us to the good news story today for our employees and for our taxpayers. The plan that we have is very unique. It is very much self-administered. We have a very hands-on approach with our employees. But our plan is so recognized because of three components. One, we have a very unique plan design where we're driving our employees and their family members to preventative care, catching things early before they turn into big high claim dollars or they turn into catastrophic events for our employees. We also have a variety of on-site services for our employees. We've tried to reduce the barriers for people getting healthier. We send them to the doctor, they get their labs drawn, they learn about their health status, and then a lot of times people have that opportunity and then they say, what next? How do I fix this? Well, we have those resources to be able to help people. And then we also have an incentive program. Our approach has been, let's try to create this carrot and stick approach where we encourage people to deal with their health and become healthier, and that's what we've seen. As a result of this, we are not seeing any premium increases for our health insurance for our employees, which is phenomenal considering across the state of Florida, the average increase for employers in their healthcare premiums is 11% increases. Nationwide, it's about 7.9% increases employers are faced with either passing on to their employees or absorbing themselves. We've had a negative trend. We are spending less now without reducing services to our employees. We're saving taxpayer dollars because we're driving people to get healthier. And it's a pretty phenomenal opportunity to talk about that today. However, we know that our population is aging. Can't stop that train. And so we're strategically trying to align our benefits so when the day comes where we do start seeing some cost increases, we're better set and our employees are better set. We never want our employees to be faced with a situation where they needed an ambulance or they need a hospital stay and they can't afford to pay their deductible. We don't want to see our employees in that situation because we care about our employees and because they provide a service to this county and we need them at their healthiest, and that's where we're at right now. So one of the recommendations that we're making that's in front of you today is currently we have a two-tier medical plan, employee only and employee family, and we're recommending that we move to a four-tier option. This gives a more variety for our employees, so our employees who have spouses who have coverage opportunities with their own employers may look at our employee plus children premium, gives them an opportunity to reduce their medical premium out of their paycheck, and gives them a few more choices. So two groups, the employee plus spouse and employee plus children tier, will see a reduction in their monthly premium. The county, the employer side, will see that reduction as well, which ultimately is we're not coming to you to say we need to find an opportunity for a 25% increase in our health care. That's not happening. One of the reasons why this is important, and this is part of our strategy, is because we've been performing well, and we know that eventually our costs are going to go up, we want to make this change now so it doesn't significantly impact the employee or the employer, or our portion, the county's share of those costs. And now's the time to do that when things are running well. It all boils down to just strategy in terms of preparing for the future. We're a self-funded plan. We have a national carrier that we use as our network, but at the end of the day, every single claim that happens, every single time one of our employees or their family members uses the hospital, gets a prescription filled, or goes to the doctor, the county pays that bill. And so it's very important for us to strategically lay out these benefits so we can continue this. This is a great benefit. It's about total compensation for our employees, and they have a wonderful benefit that helps them stay healthy, helps them learn the skills that they need to maintain that health. And so it's just great to be able to stand in front of you today and let you know that you've got this in front of you to vote on. And it's a great news story for our employees. It's a great news story for the county and our taxpayers in general. Part of what you'll also see on there is a great opportunity for our retirees. There was mention of our retiree population in the community and the impact that changes in Medicare has on that population. Obviously, a lot of them have a reduced income. So with this change to a 4-tier option, our retirees on the Your Choice Health Plan will also benefit as well. So many of them will see a reduction in their monthly premium, whether it's a supplement to Medicare or they're an under 65 retiree and it's their only coverage. So that's great for our employees who have worked for us for 25, 30 years and need us and rely on us for health care. So the other piece that you will see in there is the pharmacy. We continue to perform really well on our medical plan. Pharmacy costs across the nation are skyrocketing. A lot of that has to do with this particular class of medications called specialty medications, but that in addition to just the high cost of drugs overall, they're just rising out of control almost. And what used to be common of, take a generic drug, it's cheap. We still want to encourage people to use generic medications, but they're not always cheap anymore. So we are, again, strategically making a proposal to adjust our pharmacy benefit, continue to have our preferred networks where employees get reductions in their out-of-pocket, but to add an increase $5 copay to our generic tier for both preferred network and non-preferred network. So, thank you.
Okay, thank you. Commissioner Baugh.
Yeah, Kim, you and I we've all had some conversation, and I just want to say how excited this plan makes me. The success that the employees have had with this is just unbelievable, and I'll go ahead and mention I think a big part of it is because of the way it's set up, that the employees and dependents have an opportunity to have someone help them and guide them in the areas that they're weakest in. And I know my husband is starting a program now with you guys, and it makes me feel so much better to know that you're there, and I think that's part of the success that we're having. And so I think it's wonderful, and I look forward to you guys striving for the future to just keep improving, because I think, when we look at our county overall and the healthcare situation that we have, and then I look at the healthcare plan that we have here in the county, I just see how good perhaps healthcare can be in the county in the future for perhaps all, and I think that you're an example. You're setting an example of how good things can be. So I just hope that we continue to strive, and any way that I can help you do that in the future, let me know.
Great,
Last but not least, prescriptions. I have to say it. I think it's wonderful that we have such a great prescription benefit. It's pharmacy out east would be so nice to have, because I can tell you when you're under the weather, you don't feel like coming all the way out here to get your prescription filled. So I know Kim and I, we've had that discussion. We end up paying for it because you don't feel like coming all the way out to West Bradenton to get your prescription filled. So anything that can be done in the future on that, that's my only suggestion for improvement. $5 for a copay, come on. You know, we can't complain on that. So just a great program. Thank you for all that you and everyone does. And as an employee, I can tell you that I guess I'm not really an employee, but I have the health care, and I just think it's terrific, and I just applaud you for all that you do.
Thank you.
Commissioner Whitmore.
Just real quick, there's an employee I know that makes less than $10 an hour, and he actually taps into the local food bank. And I saw him Sunday. I gave him a phone. When I change phones, I usually give him my phones. And then his son he told me his son has to take 4 buses just to get to a special school, a gifted school for his son on 26th Street West. He takes 4 buses every day to get there. So this is going to help because it's actually going to lower his premium. I was going to bring it, I've written it all up. I talked to Ed about it yesterday, and I've talked to you about it. Thanks to commissioners attending the Florida League of Counties, 2 counties picked up on a program that actually 2 counties have adopted in the state of Florida, Flagler County and Highland County. It's called CANA RX, CANA-RX. And actually, it's a discount program of 350 drugs that are on the top most used list with a discount. Flagler County has the potential or has saved 50 to 80% on their prescriptions on some, and it's a voluntary program. So employees don't want to do this, they don't have to. And Highlands County also went from $265,000 in prescriptions that they're paying out of pocket. They saved $145,000. And Kim told me she looks at this stuff all the time, and I would please ask the county administrator to direct her to at least look at it. I have no problems. I have friends that are nurses, family that, and that live in Canada that come down here. They seem to be doing fine on the meds they're on, the common statins for blood pressure or high cholesterol. There's a formulary, and I would have no qualms about doing that. So that's a way to save our employees a lot of money, and the county, the taxpayers' money. So I would just ask if the commission has any problems with the staff at least investigating it.
That's getting money out from prescriptions from Canada?
Yeah, and it's a voluntary program. There's actually people that do it online. I wouldn't want to do it that way, but there are programs, and there's actually 2 counties in the state of Florida that have done it and saved hundreds of thousands of dollars.
Haven't there been cases of the drugs aren't what they're supposed to be? And
well, that's what you hear, but maybe if we could just have staff investigate it, because the other counties have investigated it and passed it and are doing it, and there's 2 in Florida. I read it in our Florida League of Counties magazine that we get, County News. That's what was on front page. So if somebody wants to at least look at it.
Yeah, Commissioner Whitmore, I have actually have a meeting scheduled for this coming Friday, not with that vendor, but with a similar vendor, just to start the information gathering process. So those wheels are already in motion.
Good.
But it is important, and that's part of what we do at EHB is what else is out there. We tend to be the front runner in things like health management and wellness. And even pharmacy in some of the things that we do, but it's worth exploring just to see is it something that could benefit our taxpayers, our employees. But obviously what's most critical is that we engage in whatever product that is safe for our employees and
I 100%
regulated
agree.
and that sort of thing.
And I'm glad that 2 other counties did it, because I wouldn't want to be the first one on that.
Right, that helps.
Commissioner Baugh?
No, I'm not on.
Commissioner Smith?
Yes, Madam Chair. Commissioner Whitmore is correct. The issue of health insurance and things like that, there's a lot of counties looking at that. The 2 counties that she mentioned, and it's talked to FICO. I call it FICO. I get it mixed up sometimes, but it's the same thing. But I think it's excellent. But, one thing about our insurance, I had good insurance before I came, but I couldn't beat the county insurance. My son and I had really good insurance. Now, I very seldom went to the doctor. I just was paying into it, and then when I became a county commissioner, I was forced to go through procedures. And I'll be upfront with you, it was life-changing for me. I ran into some things that I needed to check out by doing it. And so it done, just that alone has been worth this while because I never would have went. I just had insurance and was making excuses not to go. And that's why I was saying people just don't want to go.
Sure.
I had the insurance and wasn't going. And so thanks to the health program we had here, I went and got everything checked out. I had some things that I needed to take care of, and I took care of them. And so, you know, so I'm thankful for what's taking place. And if it can get better, and we already one of the top, but if we can go out there and look at other things and make it better and fine tune it and stuff, I'm all for that because the key is catching sickness and ailments before it starts to spread or starts to be something that affect your employment, your job, your health, and your family. So, I mean, I'm very thankful that what I went through, to be honest with you, because I'd have been paying that insurance each month and would have not been getting any checkouts whatsoever.
All right. Thank you for those comments. And I'll suggest, Commissioner Smith, that denial is a very happy place to be. And I'll also suggest that you chose to go do your qualifying events.
No, I was.
I didn't force you. That's the stick.
Look, they even make the appointment for you.
Yeah.
So you don't have any choice. Your appointment is this time. You have any choice.
Well, that's a great testament, though, because you're a leader up here, and you're saying to folks that this is the way to avoid expensive
It's the way to.
You do things early, and we've proven that with our system.
Yeah, it is. I mean, I'll be up front with you. I mean, they caught some things that I'd had problems with down the road if I wouldn't have went.
Right. Right.
Like
Well, thank you for
said,
sharing
we're not
that.
getting any younger.
Not getting any younger.
Okay.
We're getting better looking, though, aren't we?
On that note, we'll go to Commissioner DiSabatino.
Great, and again, you're not forced to, it's just that if you don't do that,
Pay
you
more.
don't get the best.
Pay more.
But but the
System
thing that
that's
make
here.
it good is the persistence of the employees that encouraging you.
Right.
They, you know what I'm saying? You don't have to do it, but the encouragement from her staff and from the executive staff is unbelievable.
Right, and you, every day you see the employees making me feel bad, go up and down the elevator with their bags to go to work out, and, you know, they're just really doing it right. It just, I know you'll research it, and I know you'll do the best job, it just makes me uncomfortable and nervous to go
Just
out of
to
the
get it back and
country
bring it back.
for our medication when, you know,
Canada's
it could
our
be
friends.
a control factor, so I know you'll do
get
your
that.
research.
They are our friends.
Okay, yeah, I think it's important because there's been a lot of discussion about that. But, you know, the devil's always in the details, so we're going to need details on that before
Exactly.
anyone's going to want to jump on that. Okay, what is the pleasure? I'll go ahead and open this to the public. Would anyone like to make a comment about this issue that we're going to approve the 2016 medical and dental premium rates? Anyone like to address the board?
Public comment.
Okay, seeing no one come forward, I'll go ahead and
Motion to
close.
approve.
Public
Second.
comment. We have a motion and a second. All those in favor signify by saying aye.
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 I vote aye.
Chair votes aye. Motion carries unanimously. Thank you again for all that great work you guys do, the hard work you do in helping to keep our employees healthy and keeping our costs down for the taxpayer.
Our
Very
employees
important.
are the ones making this happen.
Okay.
Employees going through this process.
And
so
they're
thank
losing,
you.
they losing a ton of weight too.
They are
Yeah.
22,000. Well, we haven't counted July yet, but so far 22,000 pounds.
Right. Okay.
Yeah.
That's great. All right, we're going to go ahead and move to the 2016 state legislative platform. Nick Azaris waiting patiently to talk about that.
Good morning, Commissioners. Thank you, Chairman Benak. Nick Azara, Information Outreach. Commissioners, every year, a few months prior to the legislative session, I appear before you and we go through the County Commission's legislative platform, and it, as you know, prioritizes all the most important things to our County Commission, and it gives our contract lobbyist, Carrie Roth, information to work from, kind of a playbook, if you will, and it also helps us in our discussions with legislators before and during the legislative session to articulate those things that are most important to the county. So this year, the process comes on us probably earlier than ever in that the legislative session in 2016 begins in January. The committee weeks have already begun. I think last week it was the first week of the committee weeks, and they meet almost every other week between now and the holidays. So it's already a busy schedule, and as you know, there's a special session scheduled for the Senate redistricting in October. So before you this morning is the draft of the board's legislative priorities. It's a bit of a departure from what we've created in the past in that it's really a slimmed down version. In years past, we've had a very long list, sometimes 30 or 40 different items, and what we learned over time is that when we're in meetings with those legislators, we have very limited time, and so we are only able to talk about 2 or 3 very important things because each of those issues typically takes several minutes to discuss. So what we've done is I've taken feedback from each of you in our briefings. I've taken feedback from our directors and staff. I've got some remarks from the port and several other of our sister government agencies, from the League of Cities to the Association of Counties and those type groups, and tried to compile what I consider to be the best of the best for you to consider this morning. And on the front side is an itemized version on funding requests, and those are 4 items that I think you're all familiar with. One of them is a little different than in years past. That item on transportation, we learned that funding from the state for local roads typically flows through the MPO. So again, from hearing from each of you, we wanted to prioritize a local road project, and that one that quickly came to the top was 15th Street East. So that item, I think, let me also say that these numbers are subject to change as cost estimates get a little more clearer focus, and we get closer to the appropriations period of the session. So those will continue to be refined a little bit. Let me also give the disclaimer that, as you know, that this is we call it a living, breathing document that's always subject to change, but again, it'll serve as a guidepost going into the committee weeks and into the session. So unless you have any questions, I know probably just enough to get me in trouble on these items for the funding requests. We'll proceed with those as the top requests for funding.
Okay, Commissioner Whitmore?
I have no problems with the platform. We've talked about it off and on for a long time now. My one thing is, and I mentioned it to Ed yesterday, and he was going to talk to you, the committees, as we all know, started earlier this year, and every committee week is every other. Well, every other is the weeks that we have our board or land use meetings. So there's hardly any way possible that we can get up there. And I know I was going to ask Ed if he would at least consider switching, because December was probably too late. It's got to be October or November. What month are we in? September now? Mm-hmm. Yeah, October or November sometime. But Nick went through the whole schedule, and every one of them we had a meeting, or they weren't there. So, and if we could at least consider maybe switching one of the meetings so that we could go up there, because Vanessa brought back the diversion diamond. We went up another time, and we almost lost our the water thing, the utilities. We were actually, no one was going to carry it. We went up there, and we gently, nicely pushed it. Those are the things that people don't realize, and both of those things brought millions of dollars back to the county. And there's sometimes our lobbyist needs to have us with them when they present before a legislator, because we're the ones, So I think it's really, even though it's a pain to drive up for 5 hours and 5 hours back, I really and truly think that we really need to try to go this year, because who even knows if they're even going to talk about Medicaid this year? I hope not, because we never got nothing done last year, but they probably will. So I think it's important that we're there, as much as as hard as it is on everybody. So I'd ask Ed, or if it's okay with the board, to move one of the dates. Are you all right with that, Ed, or?
We're looking into the dates and what's associated with the dates and what things are coming up. We'll let you know this week, but it's...
This week? Okay, good, then we'll have time.
Yeah, it is tough. I looked at the schedule too, and I couldn't figure it out, so.
Figure out one date.
I asked Nick to go ahead and work with somebody else, try to figure it out, because
Right,
it's very difficult.
there might be 2 weeks of possibility, but we'll go over that in the directors' meeting tomorrow and get back with you those dates and start planning a trip to Tallahassee.
Okay, Commissioner Ball?
Yeah, and with what Carol just said, I think it's very important that we get up there, particularly this coming year. With the session starting early this year in January, we've got to get up there in October and November. So a meeting is going to have to change. Transportation. You know what? I can't tell you how important I think it is this year, and I'm so glad to see it on your list. You know, things with transportation, as you know, we have a lot of roads, we have a lot of work in Manatee County that we need to get done. And, you know, the transportation fund that I know is in Washington, and I know they're looking at it statewide as well, very important to move something forward on this. I'm on the legislative committee at the chamber, and we've been having meetings every Monday. And Nick, I know that you're involved. You weren't there yesterday, but I know you've been there. And, you know, they want to support the county any way that they feel they can with transportation. So I'm sure that this coming weekend, that'll be a topic at the retreat is transportation. So, you know, it's just imperative that we move forward somehow.
And we may need to be responsive to change things. If things become more specific, we might need to, you know, ask for specific approvals. If there's something that's you know, heaven forbid, should we have something innovative come up, it would be nice to be, for us, we're just going to need to maybe revisit some of our position statements, possibly, as the legislation moves forward, and we need to be ready to do that.
Yeah.
Right, and this list is a good leave behind, you know, and though it's clear, very easy to read, and concise. So it's a good leave behind for those legislators, and it lets them know exactly what we're requesting. On the reverse side of this document, Commissioners, I hope Commissioner Whitmore is still listening, because I wanted to mention this item. Just minutes ago, I heard from Carrie Roth in Tallahassee, and as you know, Representative Stubbe was gracious enough to file the board's request for a change to the statute, regarding dangerous dogs. And Carrie Roth has continued to work diligently to try to line up a Senate sponsor. It's you know, difficult with competing schedules, and now the committee week's going on. But only a few minutes ago, Carrie let me know that a Senate sponsor has been lined up, and that's
good news.
yeah, Senator Bill Montford, and he's out of the Panhandle area, and Carrie is going to continue to look for co-sponsors in the Senate. But that was a big piece of news I want to bring to you this morning. That greatly improves the chances of that bill with a Senate sponsor and someone in both chambers working toward it, and it definitely gives us an important topic to be discussing when we visit in Tallahassee. The other items on this side of the list of priorities are position statements. Again, I've taken into consideration your feedback from briefings and some of the other priorities from our sister governments and other governmental agencies, and it's subject to your approval, obviously. So my hope today is if we need to pull out any and insert something else in, or just refine and then finalize it, we'll be ready to go for trips to Tallahassee.
Commissioner Smith?
Yes, Madam Chair. Nick is doing a great job, and
Always.
I think sometime with our lobbyists, I don't know if the board get the whole scope of the lobbyists. FAC has lobbyists. We have lobbyists. Every county has lobbyists. But we may take a position, and if it gets to FAC and we're not to the table, and they take a position opposite than us, those counties' position going to go into one lobbying effort, for example. So if it's something we really want, we may need to be there. You was there. Mm-hmm. I mean, if you wasn't there and you still got to go back in November, we'd have been keeping people locally for 24 months. And it would have came down, and because we wasn't there, but we advocated in some of the counties, but that would have been a mandate. So we got to have the lobbies out, because there's certain committee meetings that you have to be an elected official to even be participating. We went to St. Petersburg. They had tons of lobbyists, but they couldn't sit to the table with Commissioner Whitmore on the restore money and advocate, for example. So there's a meeting where you have to have an elected body there. And they got staff running around getting notes, checking other counties to see what stuff is being sang. So it's a team effort.
Yeah.
For example, November, we got, about $9 to $15 million on the table. That meeting that take place up there.
For the
And
Restore
people,
Act.
so we don't travel to that. I'm just saying.
And, with what, if you will, with what Commissioner Smith is saying, I know before Commissioner Smith was on the board, Nick has always kept up with FAC, and in fact, we've met with FAC when we've gone to Tallahassee with representatives from FAC, and we do try to stay aligned as much as we can. But a lot of times we do have just issues that are, just strictly for Manatee County. But we do stay in line with
But
that.
I think in my last point, I'm looking to work with State Representative Darrell Rousseau on some things too. He does some great things. You and I had that conversation. But for example, even what Commissioner DiSabatino had sent us a letter dealing with the Florida League of Cities and FAC on that issue dealing with the case. The product could have a year ago, if we was involved and could have got a vote to support, because I think it has statewide implications, but it was just so late, when you sent the email with Commissioner McClash, for example, dealing with that. I think it was a good suggestion, but we're running out of time.
She knows. Talking about. I have no idea what you're
I
talking
don't
about.
either. I don't know what you're talking about. I guess it wasn't.
Well,
shared.
I don't want to get specific in because of legal case pending, so I can talk to him about it.
Oh, I know what you're talking about. You're talking about the legal
Point of
issue,
the court.
a legal issue that the county has and where that might go. And yes.
McClash.
Yeah, I think Commissioner Smith, your point is a very good one. And that in order to set the agenda, you got to be at the table.
You got to be at
That's
the
his
table.
point,
Gotta be at
that
the
you
table.
have to be there. You have to hear. We heard some interesting things that were being talked about. We were talking about, what was it, funding? I'm trying to think, Charles, what was it? And they were going to, it was funding for, I can't remember what it was right off the top of my head. And we had to object to it because it was going to put us in a position where a different county, a charter county, would have to take this position. It was going to put us in a position that we didn't like. So we explained it to people. What was it on health?
Yeah, that's correct. It was healthcare. Healthcare, and then, it was only 20 chartered counties in the state of Florida.
Yeah.
But it was going to make us follow what they were doing.
Right.
And this recommendation was going to our lobbies from FAC to the legislators saying this is the position of the 67 counties. Well, we didn't support that.
Right.
We didn't agree with it, but we were to the table.
Right.
And I'm glad Madam Chair was there, because that was back and forth. Thank God we had some other commissioners there that was opposed to it. But for example, let's say if we wouldn't have showed up, and 3 or 4, the jail thing is a situation where if we wasn't there, and it's coming back.
That was it specifically. It was the jail
Yeah, funding.
And they were trying to make a deal saying that they wouldn't ask for this funding. We said, well, whoa, we don't want to go down that path.
yeah.
We don't want to have that
So-
funding proposal put out that way, even though they felt that that was the way it was going to pass. So, you know what I'm talking about, Nick.
This was a proposal that would require counties to house inmates that are currently in prison. Those who have fewer than 24 months remaining on their sentence would then be, if there was an extreme overcrowding situation in the prison, the state would then have the authority to bump those with less than 24 months down into the county jail.
$67 a day.
And the county's voiced concern that, well, if you're going to do that, it's got to come with some dedicated state funding. But then those other counties opposed to it took us a firm stance and said, don't even open the door.
Open that door.
Oppose all out. So I think that's where
That's
they ended
correct. They were basically agreeing to accept the 24 months and was going to make a recommendation to the legislators that we as a body, the 67 counties, do accept that. And we say no.
I think it may have been an attractive proposition for some of the smaller counties, but
And
the others like
that's-
Manatee.
You just hit it. It's attractive to some of the smaller counties that was pushing this. And they was they was advocating for it, for that. And we didn't want anything to do with it. And then the sheriff of Pinellas County came and said, well, it costs about maybe $80 a day.
Yes.
for an inmate,
Yeah.
not 67.
Yeah.
And then the medical issue that you have, and the people that are sick, in prison and stuff, you inherit all of that. Plus, the jails are not built for 2 years.
Right. Right. So that, yeah, and the point again is, we generally try to support FAC, but if you're not at the table and you're not listening, you got to be careful because you have an opportunity to change the position, and if we're going to continue to work with FAC and have them be a good support, that we need to make sure that we know exactly what they're promoting and be at the table to talk about it. Commissioner DeSabatino?
Well, perhaps there's another avenue that the DOJ can take is they partner with the Bradenton Bridge and that concept where they have people coming out of incarceration from prison, less than 2 years on their sentence. They have the facility here in South County for the women, and I think it's near Orlando for men. And maybe they need to work on more of those transition centers rather than keep them in incarceration. So maybe that's something you can explore. Because I know when they were going to be losing their funding, we all jumped, everyone helped to get them to save the center here. And so maybe they need to, like we're talking about diversionary emergency clinics rather than the ER. This is the same idea, and they get really good results. So maybe that's something we can work on.
Sure, and you should bring that up. That was one of the frustrating things. I know we're kind of going off topic a little bit, but that was one of the kind of the frustrating things to me about FAC is we didn't hear enough about good ideas like that. Well, rather than just saying, oh, we're going to change this and provide funding, we're going to have it now being taken at the local level, and everybody said no. But there should be more of an opportunity at FAC to hear what are other counties doing? What are some of the innovative things? And that was a little frustrating to
And
me.
perhaps-
It came out of committee
Right.
the day before, and you got a FAC board, a state board, and a president. It came out of committee, and the small counties pushed it to get it there.
Well, and perhaps, I don't know if you've been to the Bradenton Bridge, I'll give you the name, and you can make an
I think
appointment.
I'm interested in that.
And you will see that, and if you want to, carry the baton up to Tallahassee on that.
Yeah.
Okay, is there any thing that anybody would like changed on this? Again, this is a living, breathing document. It's subject to change, but it's something we're going to start out with our positions. Are there any concerns, questions about it?
No, Madam Chair, other than I want to meet with State Representative Darrell Rousson on some things, maybe help the urban core that he works in Pinellas County, that we can get over here. But I haven't spoke to him, but he talked to me before I was elected. There's some things, additional funds that can come in here dealing with the urban core, and he's working in Pinellas County to get, it may be already there. And so I think he talked to staff and maybe the county administrator briefly with it. But if that's coming back around, I want to have a conversation with him and get with the county administrator, Nick, on that funding that he was mentioning that can really help this county.
Okay, well, at this time, do we want to go ahead and approve this moving forward?
So moved.
Second.
Okay, we have a motion and a second. All those in favor signify by saying aye.
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 Larry?
Aye.
Larry's there. Chair votes aye. Motion passes 6-1. Carol has stepped out. All right, well, can we finish this, or what are we going to do? You guys want to keep going? You want to finish? You want to come back?
Remember, we got to go 3 and come back later anyway. We got to go to lunch. Got that
So
free
we
mandate.
have DJJ and then just commissioner comments.
Commissioner
and
comments.
dashboard.
Yeah.
DJJ.
That should be quick, right?
You want to take DJJ? Yeah, because I would like to finish up so we don't have to come back till 3 if possible. So we'll take this quickly.
Thank you, Madam Chairman, Commissioners, Mr. Hunziker, Mr. Palmer, Ms. Colonisa. Glad to have you here, and staff. I'm Brenda Rogers, Director of the Community Services Department, and we're here today to talk to you about our Department of Juvenile Justice payments for the fiscal year, the state's fiscal year that started July of 2015. We're asking for your authority to continue the method of paying the 32% rather than paying the full amount, holding the balance in our reserves pending the litigation that is still ongoing. We anticipate that litigation will be through December of 15. So, and we have Attorney Christopher DiCarlo here to answer your legal questions.
Okay, are there questions for staff? Commissioner Smith, did you have a question?
No, Madam Chair, I don't. Thank you.
Commissioner DeSabatino?
I don't have questions, but I just want to, commend you, because I had questions if you were putting the money away in a reserve, and I was told that we are, in case they have to have a clawback and they want to recapture the money that we're putting aside, that we would have a funding stream for that.
That is the
Yes.
change in this year's legislature determined that there would be a clawback clause, and so they may very well withhold from your general revenue dollars that come into the county. So
Okay.
that would be the way that they would recoup it. But our outside legal counsel has advised us that for us to have a standing in future litigation and the ongoing litigation, we need to stay the course.
Because it is expensive, and I was just, the 32% is the equivalent of $40,000 a month, something like that. So that adds up quite a bit.
It does.
Yeah, thank you.
So to maintain our consistent legal position, this is what you're recommending, so that makes sense. I mean, we have to stay consistent with our position that we're advocating for. So that's what we're doing, but we have an insurance policy in case, we never know how these things are going to work out, but we're continuing through this process, and hopefully they'll make sure that they abide by the decision that was handed down. But it's an interesting position that we've got between the legal system and the legislative to see who can get the last word in.
That's correct. Madam Chair, Commissioners, Mr. Palmer, Mr. Hunsaker, I mean, I would echo those comments. I think the concept is for us to be, as counties, a good partner with the state with regard to these costs. However, in light of the treatment that the state has applied in the past with regard to the ongoing litigation, which reflects failure to refund monies to the counties for overpayments, which is where we currently are. And it is the recommendation and legal opinion of outside counsel that with regard to the implementation of this clawback provision, that there may be some issues from a legal perspective as to the propriety of that. In other words, how that was utilized and put into an implementing bill or appropriations bill. Our legal counsel feels that that is not necessarily a legally appropriate way for that to be applied. So there are some other counties that are also along with us taking the position that they are going to not make their quote-unquote full percentage of payments to the state in order for us to have standing to challenge the clawback provision. The opinion of outside counsel is that we need to go ahead and make those continue to make those withholdings. Now, the representation that we have received through the communications via DJJ in TUFAC is that that clawback provision will only be applied going forward prospectively, not retroactively. So it's only going to apply to the payments, going forward, and not to try to claw back monies in the past. But in consultation with our outside counsel, that is the recommendation, and the 32% is consistent with what the board has previously authorized in the past.
Okay, thank you. Any other questions for staff? All right, anybody who would like to address the board on this issue? Okay, seeing no one come forward, I'm going to go ahead and close public comment. There's a couple of motions here. What is the pleasure of the board?
Motion to approve.
Second.
All right, we have authorized monthly payments. That's the first motion. All those in favor signify by saying aye.
Aye.
All those opposed, nay.
Larry, aye.
Larry and the chair votes aye. Then the second motion was authorize the chair to sign a letter on behalf of the county commission.
So moved.
Second.
Okay, we have a motion and a second. All those in favor signify by saying aye.
Aye.
All those opposed, nay. Chair votes aye.
Larry?
Larry, did you vote?
Yes, aye.
Larry votes aye. Motion carries unanimously, which is 6-0 at this point. Okay, thank you for your good work on this. I'm sure we will work this issue out moving forward. I'll be optimistic. All right, that closes our regular business. If we could do commissioner comments kind of quick.
I'll be good then.
I'm sorry,
I'm
was there
good.
something else that we missed? I'm gonna ruin it. What one?
We just,
Oh, the dashboard report, we really do, it's just for informational purposes only, dashboard, and I don't see anyone who wants to ask any questions in the audience, so that's really just for our information. Everyone gets an opportunity to look at it, unless the administrator has anything he wants to comment on.
No, ma'am.
Okay.
It might be appropriate that when we when we have the dashboard report, since it is an agenda item, to just briefly say agenda 53 from here on out. If there's are there any questions or concerns? That way the clerk can note it in her
Okay.
minutes to make it official. This way it's up to her and she can't.
Okay.
She's not here to make up things.
All right, well, I opened the public hearing on the dashboard. If there was anyone, or not public hearing, public comment, if anybody had any questions.
No.
All right, seeing no one come forward, I'll go ahead and close the public comment. And again, there's no action necessary on that item. Thank you. Now we'll move on to commissioner comments.
Just to remind everybody, coastal cleanup October 3rd. Check your local areas. I'm going to be checking out the beach area probably and clean up some things. Help. That's it. I'm not, I'll make it quick.
Okay.
Oh, you know, we did get that letter on recycling, 51%. So that's
Isn't that awesome?
it's a great achievement by Manatee County, by the residents of Manatee County, and wanting to recycle. So
That's right, and we're going to continue to make improvements to our recycling, so we look forward to that.
Right, and our new, or our revised or extended contracts say we're going to go to a single stream, and that should really bump that up next year.
United Way had a nice casino night.
Yes?
Congratulations. And yeah, I'll let you guys
Okay.
carry it out. Take
Just
her home.
quick, driving by Bennett Park the other day, what's the status of the water park? Anything?
We're still in negotiations with the one remaining responder to the RFP, and I think there are some discussions that will be taking place this week.
Okay. And then we discussed earlier about the county attorney has a $20,000 amount, and then we were going to ask what the county administrator has, or you can come back to us at the next meeting with a report on that. Mr. Wheeler's comments regarding the railroad track, I know Mr. Schulhofer is looking at it. It's State Road 70 and the railroad, so they are working on it.
Madam Chair, if I might on that subject, just so the viewing public is clear, this board has no authority whatsoever, maintenance or otherwise, over the local railroad network.
Right.
This board has no maintenance authority over the very crossing that the citizen mentioned, which is a state road. However, if you'll indulge me, the World Wide Web is a wonderful thing. Mr. Wheeler, I Googled CSX Railroad, and the 5th entry on the page is a number to call with maintenance-related complaints. I have the emergency number, the non-emergency number, I have the local number all written down for you. I have the local office of CSX written down for you on 26th Avenue East, so I would urge you to go visit their local office and see them in person. So anyway, I've written it all down for you, sir.
Can you share it with us too? That would be great.
Sure, sure.
Parking on the sidewalks, I know in communities, people, their driveways aren't long enough and they park on sidewalks. And I know that's an issue, not just in Briarwood, all over, and you have to, circumvent your path. Let's see, Glenn isn't here, but maybe you can just let us know, what's the date again on the remote area medical that people?
Actually, I kind of want to go to Kiwanis because Dr. Conard's speaking there, so I'm going to get up from here and leave
Regarding
if
that,
possible.
so
Yes.
maybe you can report back when they're
Yes,
having
it
that.
is the weekend of, it's the same weekend as the FAC.
In November?
November, yes.
November, right before Thanksgiving. Okay. So I'd like to know if you can get a report of who's going to qualify to attend, and do they have to sign up in advance or just show up or whatever?
Maybe I'll ask Dr. Conard to
Okay.
come and speak about it and do a presentation. Since it's not really a county program, it's separate, so I'll ask Dr. Conard if he'd like to come and have an opportunity to talk about it.
And also, Mr. Jamalina had sent us emails this weekend regarding the trucks in New Pierce, and I had forwarded to the sheriff, and Sergeant Kenyon was very responsive, emailed him back right away. I think we all got copied, that he shared his private cell phone and information, so Glenn can call them directly and get addressed quickly. So you're going to let us know about the $2.5 million on the sheriff's freezers later today, I guess? And also regarding the budget in advance, the two items that I had brought up for Gulf Coast Legal and Legal Aid regarding that funding, regarding outcome, if we can get a report on outcomes, how many people are serviced and any satisfaction, because I personally have had not good reports, but that's samples of 5 people. That's it for now. Thank you.
Okay, I'm going to go ahead and step out and turn the meeting over to Vanessa. I don't
that's
have
tough.
anything specifically to report on right now.
I'm stepping out also.
Okay.
Step on out, Larry.
Now,
Commissioner Smith, commissioner comments?
Just briefly, I toured Samoset. I went through there with Mr. Williamson and seen some of the issues that he was talking about in Samoset, dealing with the ditches and possibility of sidewalks and the complaints of some of the residents. And I'll be talking to Mr. Hunsaker concerning that. Glenn mentioned the housing. Madam Chair appointed me as chairman of the Housing Committee, and we haven't met since I've been a commissioner. And I don't think they had met 2.5 or 3 years prior to me becoming a commissioner. So I need to talk to Mr. Hunsaker. What is the role of that committee or board? Because I don't believe in serving as figureheads of boards. And when you got affordable home situation, you got veterans, homeless, and you got people who want to build and develop affordable houses knocking on county commissioners' doors. So I would talk to him more about that. That's it, Madam Chair.
Okay,
Thank you.
great. I had one thing that I was going to bring up, but I'll hold off until another day when all the commissioners are present. It's in my district. It's a road. You all received an email from staff. Hidden River Trail. We need to have a major discussion on that, but I'll wait until we come back to another meeting. In the meantime, the only other thing I would mention is we have the 3 o'clock shade meeting upstairs on the 9th floor. So anyone, Mr. County Administrator, County Attorney, any comments?
No, ma'am?
No?
Then this meeting is adjourned. I'll see you all at 3 o'clock upstairs.